NCLEX RN Test 1 for 2026. Question 1. A client with ascites is scheduled for a paracentesis. Which instruction should be given to the client before the procedure? Here are the options. Option A. You will need to lay flat during the procedure. Option B. You need to empty your bladder before the procedure. Option C. You will be asleep during the procedure. Option D. The doctor will inject a medication during the procedure. The correct answer is option B. You need to empty your bladder before the procedure. Correct answer. You need to empty your bladder before the procedure. Question 2. A client's lab values reveal Hgb 12.6, WBC 6500 Cu.mm, K plus 1.9, uric acid 7.0, Na plus 136, and platelets 178, 0 Cu.mm. The nurse evaluates that the client is experiencing which of the following? Hypernatremia, hypokalemia, myelosuppression, leukopenia. Here are the options. Option A. Hypokalemia. The correct answer is option A. Hypokalemia. Correct answer. Hypokalemia. Question 3. The nurse is caring for the client who has been in a coma for 2 months. He has signed a donor card, but the wife is opposed to the idea of organ donation. How should the nurse handle the topic of organ donation with the wife? Here are the options. Option A. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Option B. Tell her that because her husband signed a donor card, the hospital has the right to take the organs upon the death of her husband. Option C. Explain that it is necessary for her to donate her husband's organs because he signed the permit. Option D. Refrain from talking about the subject until after the death of her husband. The correct answer is option A. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Correct answer. Tell the wife that the hospital will honor her wishes regarding organ donation, but contact the organ retrieval staff. Question 4. Due to a high census, it has been necessary for a number of clients to be transferred to other units within the hospital. Which client should be transferred to the postpartum unit? Here are the options. Option A. A 66-year-old female with gastroenteritis. Option B. A 40-year-old female with a hysterectomy. Option C. A 27-year-old male with severe depression. Option D. A 28-year-old male with ulcerative colitis. The correct answer is option B. A 40-year-old female with a hysterectomy. Correct answer. A 40-year-old female with a hysterectomy. Question 5. Before administering thiourethiophylline, the nurse should check the patients. Here are the options. Option A. Output. Option B. Blood pressure. Option C. Pulse. Option D. Temperature. The correct answer is option C. Pulse. Correct answer, pulse. Question 6. Which information should be given to the patient undergoing radiation therapy for breast cancer? Here are the options. Option A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Option B. Moisturize the radiation site with oil-based lotion to prevent blistering. Option C. Use bath oil when tub bathing to prevent drying and peeling. Option D. Report redness and soreness of the area to the physician. The correct answer is option A. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Correct answer. Avoid exposing radiation areas to sunlight during treatment time and for a year after completion of therapy. Question 7. The charge nurse is making assignments for the day. After accepting the assignment to care for a client with leukemia, the nurse tells the charge nurse that her child has chickenpox. Which initial action should the charge nurse take? Here are the options. Option A. Change the nurse's assignment to another client. Option B. Explain to the nurse that there is no risk to the client. Option C. Ask the nurse if the chickenpox have crusted. Option D. Ask the nurse if she has ever had the chickenpox. The correct answer is option D. Ask the nurse if she has ever had the chickenpox. Correct answer. Ask the nurse if she has ever had the chickenpox. Question 8. Which statement is true regarding therapy with Levemir insulin detemir? Here are the options. Option A. The onset is 1-2 hours. Option B. It may be mixed with regular insulin. Option C. It peaks in 2-3 hours. Option D. The duration is 24 hours. The correct answer is option D. The duration is 24 hours. Correct answer. The duration is 24 hours. Question 9. Which client should be assigned to the nursing assistant? Here are the options. Option A. The 18-year-old with a fracture to 2 cervical vertebrae. Option B. The infant with meningitis with a temperature of 101 degrees F. Option C. The elderly client with a thyroidectomy 4 days ago. Option D. The client with a thoracotomy 2 days ago. The correct answer is option C. The elderly client with a thyroidectomy 4 days ago. Correct answer. The elderly client with a thyroidectomy 4 days ago. Question 10. The physician has ordered the Schilling test for a patient with suspected pernicious anemia. What other vitamin level is often assessed at the same time as the B12 level? Here are the options. Option A. Folic acid. Option B. Pyridoxine. Option C. Ascorbic acid. Option D. Thiamine. The correct answer is option A. Folic acid. Correct answer. Folic acid. Question 11. The client is admitted to the emergency room with shortness of breath, anxiety, and tachycardia. His ECG reveals atrial fibrillation with a ventricular response rate of 130 beats per minute. The doctor orders quinidine sulfate. While he is receiving quinidine, the nurse should monitor his ECG for. Here are the options. Option A. Peaked P wave. Option B. Elevated ST segment. Option C. Inverted T wave. Option D. Prolonged QT interval. The correct answer is option D. Prolonged QT interval. Correct answer. Prolonged QT interval. Quinidine can cause widened QT intervals and heart block. Question 12. A 25-year-old client arrives in the emergency room with a possible fracture of the right femur. The nurse should anticipate an order for. Here are the options. Option A. Bryant's traction. Option B. Ice to the entire extremity. Option C. buccal traction. Option D, an abduction pillow. The correct answer is option C, buccal traction. Correct answer, buccal traction. Question 13. Which statement should be included in the teaching session of a client scheduled for a renal biopsy? Here are the options. Option A, you will be placed in a sitting position for the biopsy. Option B, you may experience a feeling of pressure or discomfort during aspiration of the biopsy. Option C, you will be asleep during the procedure. Option D, you will not be able to drink fluids for 24 hours following the study. The correct answer is option B. You may experience a feeling of pressure or discomfort during aspiration of the biopsy. Correct answer. You may experience a feeling of pressure or discomfort during aspiration of the biopsy. Question 14. The client is admitted with chronic obstructive pulmonary disease. Blood gases reveal pH 7.36, code 245, O284, bicarb 28. The nurse would assess the client to be in. Here are the options. Option A, uncompensated acidosis. Option B, compensated alkalosis. Option C, compensated metabolic acidosis. Option D, uncompensated metabolic acidosis. The correct answer is option C, compensated metabolic acidosis. Correct answer, compensated metabolic acidosis. Question 15. Before administering intravenous chemotherapy to the patient being treated, the nurse should. Here are the options. Option A, administer a bolus of Roman 4 fluid. Option B, administer pain medication. Option C, administer an antiemetic. Option D, allow the patient a chance to eat. The correct answer is option C, administer an antiemetic. Correct answer, administer an antiemetic. Question 16. Which one of the following statements is correct when measuring the client for crutches? Here are the options. Option A, a distance of 5 finger breadths should exist between the top of the crutch and the axilla. Option B, the nurse should measure 3 inches between the top of the crutch and the axilla. Option C, the client's elbows should be flexed at a 10 degrees angle. Option D, the crutches should be extended 8 to 10 inches from the side of the foot. The correct answer is option B. The nurse should measure 3 inches between the top of the crutch and the axilla. Correct answer. The nurse should measure 3 inches between the top of the crutch and the axilla. Question 17. A patient of Greek descent has been prescribed Vactrim sulfamethoxazole-trimethoprim for treatment of a urinary tract infection. Before beginning the medication, the patient should be assessed for which of the following disorders? A G6PD deficiency, beta thalassemic sickle cell anemia, von Willebrand disease. Here are the options. Option A, G6PD deficiency. The correct answer is option A, G6PD deficiency. Correct answer, G6PD deficiency. Question 18. The physician has ordered Coumadin sodium warfarin for a client with thrombophlebitis. The order should be entered to administer the medication at. Here are the options. Option A, 090. Option B, 1,200. Option C, 1,700. Option D, 2,100. The correct answer is option C, 1,700. Correct answer, 1,700. Question 19. The nurse is caring for a client with cerebral palsy. The nurse should provide frequent rest periods because here are the options. Option A. Grimacing and writhing movements decrease with relaxation and rest. Option B. Hypoactive deep tendon reflexes become more active with rest. Option C. Stretch reflexes are increased with rest. Option D. Fine motor movements are improved by rest. The correct answer is option A. Grimacing and writhing movements decrease with relaxation and rest. Correct answer. Grimacing and writhing movements decrease with relaxation and rest. Question 20. The nurse is assisting in the care of a patient who is 2 days post-operative from a hemorrhoidectomy. The nurse would be correct in instructing the patient to, here are the options. Option A. Avoid a high-fiber diet. Option B. Continue to apply ice packs. Option C. Take a laxative daily to prevent constipation. Option D. Use a sitz bath after each bowel movement. The correct answer is option D. Use a sitz bath after each bowel movement. Correct answer. Use a sitz bath after each bowel movement. Question 21. A client with an abdominal aortic aneurysm is admitted in preparation for surgery. Which findings should be reported to the doctor? Here are the options. Option A. A WBC of 14. Option B. Auscultation of abdominal bruit. Option C. Complaints of lower back pain. Option D. A platelet count of 175. The correct answer is option A. A WBC of 14. Correct answer. A WBC of 14. Question 22. The nurse is performing an assessment on a client with possible pernicious anemia. Which finding is specific to pernicious anemia? Here are the options. Option A. A weight loss of 10 pounds in 6 months. Option B. Fatigue. Option C. Glossitis. Option D. Pallor. The correct answer is option C. Glossitis. Correct answer. Glossitis. Question 23. The nurse is making assignments for the day. The staff consists of an RN, an LPN, and a nursing assistant. Which client could the nursing assistant care for? Here are the options. Option A. A client with Alzheimer's disease. Option B. A client with pneumonia. Option C. A client with cirrhosis. Option D. A client with thrombophlebitis. The correct answer is option A. A client with Alzheimer's disease. Correct answer. A client with Alzheimer's disease. Question 24. The client is diagnosed with multiple myeloma. The doctor has ordered cyclophosphamide cytoxan. Which instruction should be given to the client? Here are the options. Option A. Walk about a mile a day to prevent calcium loss. Option B. Increase the fiber in your diet. Option C. Report nausea to the doctor immediately. Option D. Drink at least 8 large glasses of water a day. The correct answer is option D. Drink at least 8 large glasses of water a day. Correct answer. Drink at least 8 large glasses of water a day. Question 25. While caring for an elderly patient with hypertension, the nurse notes the following vital signs: BP of 140/40, pulse 120, respirations 36. The nurse's initial action should be to. Here are the options. Option A. Report the findings to the physician. Option B. Recheck the vital signs in 1 hour. Option C. Ask the patient if he is in pain. Option D. Compare the current vital signs with those on admission. The correct answer is option A. Report the findings to the physician. Correct answer. Report the findings to the physician. Question 26. The charge nurse overhears the patient care assistant speaking harshly to the client with dementia. The charge nurse should. Here are the options. Option A. Change the nursing assistant's assignment. Option B. Explore the interaction with the nursing assistant. Option C. Discuss the matter with the client's family. Option D. Initiate a group session with the nursing assistant. The correct answer is option B. Explore the interaction with the nursing assistant. Correct answer. Explore the interaction with the nursing assistant. Question 27. Which action by the home health nurse indicates a knowledge of the needs of an elderly client? Here are the options. Option A. Teaching regarding availability and services offered by hospice care. Option B. Speaking in a higher-pitched voice tone to facilitate hearing. Option C. Encouraging fluid restriction to prevent nighttime voiding. Option D. Reinforcing teaching regarding the prevention of falls. The correct answer is option D. Reinforcing teaching regarding the prevention of falls. Correct answer. Reinforcing teaching regarding the prevention of falls. Question 28. A client with glomerulonephritis is placed on a low-sodium diet. Which of the following snacks is suitable for the client with sodium restriction? Peanut butter cookies, grilled cheese sandwich, cottage cheese, and fruit fresh peach. Here are the options. Option A. Fresh peach. The correct answer is option A. Fresh peach. Correct answer. Fresh peach. Question 29. The nurse can help alleviate the discomfort the client is experiencing associated with xerostomia by limiting fluid intake, administering an analgesic, splinting swollen joints, providing sugarless hard candy. Here are the options. Option A. Providing sugarless hard candy dry mouth. The correct answer is option A. Providing sugarless hard candy dry mouth. Correct answer. Providing sugarless hard candy dry mouth. Question 30. The client returns to the recovery room following repair of an abdominal aneurysm. Which finding would require further investigation? Pedal pulses, regular urinary output 20 ml in the past hour, blood pressure 108/50, oxygen saturation 97%. Here are the options. Option A. Urinary output 20 ml in the past hour. The correct answer is option A. Urinary output 20 ml in the past hour. Correct answer. Urinary output 20 ml in the past hour. Question 31. The nurse has an order for the administration of intravenous heparin. The medication should be administered using a /N meter chamber infusion controller intravenous filter 3-way stopcock. Here are the options. Option A. Infusion controller. The correct answer is option A. Infusion controller. Correct answer, infusion controller. Question 32. A patient is diagnosed with secondary syphilis. The nurse can expect the patient to have copper penny rash on the palms of the hands and soles of the feet, localized tumors in the skin, bones, and liver chancres, and lymphadenopathy, general paresis. Here are the options. Option A. Copper penny rash on the palms of the hands and soles of the feet. The correct answer is option A. Copper penny rash on the palms of the hands and soles of the feet. Correct answer. Copper penny rash on the palms of the hands and soles of the feet. Question 33. The nurse is assessing the abdomen. The nurse knows the best sequence to perform the assessment is inspection, auscultation, palpation, auscultation, palpation, inspection, palpation, inspection, auscultation, inspection, palpation, auscultation. Here are the options. Option A. Inspection, auscultation, palpation. The correct answer is option A. Inspection, auscultation, palpation. Correct answer, inspection, auscultation, palpation. Question 34. A client is scheduled for surgery in the morning. Which of the following is the primary preoperative responsibility of the nurse? Making sure the vital signs are recorded, obtaining a signed permit for surgery, explaining the surgical procedure, answering questions about the surgery. Here are the options. Option A. Making sure the vital signs are recorded. The correct answer is option A. Making sure the vital signs are recorded. Correct answer. Making sure the vital signs are recorded. Question 35. A 70-year-old male who is recovering from a stroke exhibits signs of unilateral neglect. Which behavior is suggestive of unilateral neglect? The client is observed shaving only one side of his face. The client is unable to complete a range of vision without turning his head side to side. The client is unable to carry out cognitive and motor activity at the same time. Here are the options. Option A. The client is observed shaving only one side of his face. The correct answer is option A. The client is observed shaving only one side of his face. Correct answer. The client is observed shaving only one side of his face. Question 36. The nurse is performing discharge teaching on a client with diverticulitis who has been placed on a low-roughage diet. Which food would have to be eliminated from this client's diet? Roasted chicken noodles, cooked broccoli, custard. Here are the options. Option A. Cooked broccoli. The correct answer is option A. Cooked broccoli. Correct answer, cooked broccoli. Question 37. The doctor orders 2% nitroglycerin ointment in a 1-inch dose every 12 hours. Proper application of nitroglycerin ointment includes rotating application sites, limiting applications to the chest, rubbing it into the skin, covering it with a gauze dressing. Here are the options. Option A. Rotating application sites. The correct answer is option A. Rotating application sites. Correct answer. Rotating application sites. Question 38. The client has an order for fesol ferrous sulfate. To promote absorption, the nurse should administer the medication with milk, meal, orange juice undiluted. Here are the options. Option A. Orange juice. The correct answer is option A. Orange juice. Correct answer, orange juice. Question 39. Which information should be given to the client using a TENS unit? Electrocution may occur if you use water with this unit. Skin irritation may occur with prolonged use of the unit. The unit can be placed anywhere on the body without fear of adverse reactions. A cream or lotion should be applied to the skin before applying the unit. Here are the options. Option A. Skin irritation may occur with prolonged use of the unit. The correct answer is option A. Skin irritation may occur with prolonged use of the unit. Correct answer. Skin irritation may occur with prolonged use of the unit. Question 40. The nurse is making initial rounds on a client with a C5 fracture stabilized by Crutchfield tongs. Which equipment should be kept at the bedside? Forceps, torque wrench, wire cutters, screwdriver. Here are the options. Option A. Torque wrench. The correct answer is option A. Torque wrench. Correct answer. Torque wrench. Question 41. The client with diabetes is preparing for discharge. During discharge teaching, the nurse assesses the client's ability to care for himself. Which statement made by the client would indicate a need for follow-up after discharge? I live by myself. I have trouble seeing. I have a cat in the house with me. I usually drive myself to the doctor. Here are the options. Option A. I have trouble seeing. The correct answer is option A. I have trouble seeing. Correct answer. I have trouble seeing. Question 42. Which of the following post-operative diets is appropriate for the client who has had a hemorrhoidectomy? High-fiber lactose-free bland clear liquid. Here are the options. Option A. Lear liquid. The correct answer is option A. Lear liquid. Correct answer. Lear liquid. Question 43. The nurse is assessing the vital signs of a client with pancreatic cancer. In addition to routine vital signs, the nurse assesses the fifth vital sign of anorexia, pain, insomnia, fatigue. Here are the options. Option A. Pain. The correct answer is option A. Pain. Correct answer, pain. Question 44. A home health nurse is planning for her daily visits. Which client should the home health nurse visit first? A client with AIDS being treated with foscavir foscarnet, a client with a fractured femur in a long leg cast, a client with a recent laryngectomy for laryngeal cancer, a client with diabetic ulcers to the left foot. Here are the options. Option A. Laryngectomy for a laryngeal cancer. The correct answer is option A. Laryngectomy for laryngeal cancer. Correct answer. Laryngectomy for laryngeal cancer. Question 45. The nurse is removing a peripherally inserted central catheter PICC. The nurse should position the patient in which position? Fowler's right side lying, left side lying, Trendelenburg. Here are the options. Option A. Trendelenburg. The correct answer is option A. Trendelenburg. Correct answer, Trendelenburg. Question 46. The nurse is assigning staff for the day. Which client should be assigned to the nursing assistant? A 5-month-old with bronchiolitis, a 10-year-old who is 2-day post-appendectomy, a 2-year-old with periorbital cellulitis, a 1-year-old with a fractured tibia. Here are the options. Option A. A 10-year-old who is 2-day post-appendectomy. The correct answer is option A. A 10-year-old who is 2-day post-appendectomy. Correct answer. A 10-year-old who is 2-day post-appendectomy. Question 47. Which of the following is a late sign associated with oral cancer? Warmth, odor, pain, ulcer with flat edges. Here are the options. Option A. Pain. The correct answer is option A. Pain. Correct answer, pain. Question 48. A client with an ileostomy is being discharged. Which teaching should be included in the plan of care? Using Carrea powder to seal the bag. Irrigating the ileostomy daily. Using stomadhesive as a skin protector, using a stool softener as needed. Here are the options. Option A. Using stomadhesive as a skin protector. The correct answer is option A. Using stomadhesive as a skin protector. Correct answer. Using stomadhesive as a skin protector. Question 49. The nurse discovers a patient care assistant looking through the client's belongings while the client is out of the room. Which action should be taken by the nurse? Discuss the nursing assistant's behavior with the family. Report the incident to the charge nurse. Monitor the situation and note whether any items are missing. Ignore the situation until items are reported missing. Here are the options. Option A. Report the incident to the charge nurse. The correct answer is option A. Report the incident to the charge nurse. Correct answer. Report the incident to the charge nurse. Question 50. The physician has prescribed Xivoxalinzolid for a patient with VRE. The concurrent use of which of medication may result in serotonin syndrome? Nexium, esomeprazole, Zoloft, sertraline, Lipitor, atorvastatin, Zitexedirazine. Here are the options. Option A. Zoloft, sertraline. The correct answer is option A. Zoloft, sertraline. Correct answer. Zoloft, sertraline. Question 51. The doctor has ordered antithrombotic stockings to be applied to the legs of a client with peripheral vascular disease. The nurse knows antithrombotic stockings should be applied before the client arises in the morning, with the client in a standing position after the client has bathed, and applied lotion to the legs before the client retires in the evening. Here are the options. Option A. Before the client arises in the morning. The correct answer is option A. Before the client arises in the morning. Correct answer. Before the client arises in the morning. Question 52. The nurse is planning room assignments for the day. Which client should be assigned to a private room if only one is available? The client with Cushing's disease, the client with diabetes, the client with acromegaly, the client with myxedema. Here are the options. Option A. The client with Cushing's disease condition makes him more susceptible to infection. The correct answer is option A. The client with Cushing's disease condition makes him more susceptible to infection. Correct answer. The client with Cushing's disease condition makes him more susceptible to infection. Question 53. The physician has ordered atropine sulfate 0.4 mg IM before surgery. The medication is supplied in 0.8 mg per milliliter. How much medication should the nurse prepare to administer? 0.25 ml, 0.5 ml, 1 ml, 1.25 ml. Here are the options. Option A. 0.5 ml. The correct answer is option A, 0.5 ml. Correct answer, 0.5 ml. Question 54. A client is scheduled to have a cardiac CTA with contrast. Before the procedure, the nurse should assess the patient for allergies to shellfish or iodine, allergies, the ability to lie prone for 30 minutes, a history of reaction to nitrates, the presence of body tattoos. Here are the options. Option A, allergies to shellfish or iodine, allergies. The correct answer is option A, allergies to shellfish or iodine, allergies. Correct answer, allergies to shellfish or iodine, allergies. Question 55. Which statement made by the student nurse indicates the need for further teaching regarding the administration of heparin? I will administer the medication 1-2 inches away from the umbilicus. I will not massage the injection site after administering the heparin. I will check the PTT before administering the heparin. I will need to gently aspirate when I give the heparin. Here are the options. Option A, I will need to gently aspirate when I give the heparin. The correct answer is option A, I will need to gently aspirate when I give the heparin. Correct answer, I will need to gently aspirate when I give the heparin. Question 56. The nurse is caring for a client with beta thalassemia major. Which therapy is used to treat beta thalassemia major? Roman 4 fluids, frequent blood transfusions, oxygen therapy, iron therapy. Here are the options. Option A, frequent blood transfusions. The correct answer is option A, frequent blood transfusions. Correct answer, frequent blood transfusions. Question 57. The client with a recent liver transplant asks the nurse how long he will have to take an immunosuppressant. Which response is correct? 1 year, 5 years, 10 years, life. Here are the options. Option A, life. The correct answer is option A, life. Correct answer, life. Question 58. The nurse is caring for a patient following a thyroidectomy. Which of the following is an early symptom of hypocalcemia? Positive Ch sign 3+, deep tendon reflexes, numbness or tingling of the toes and extremities, prolonged ST and QT intervals. Here are the options. Option A, numbness or tingling of the toes and extremities. The correct answer is option A, numbness or tingling of the toes and extremities. Correct answer, numbness or tingling of the toes and extremities. Question 59. Which of the following is the best indication of resolution of a paralytic ileus? Passage of stool, eructation, presence of bowel sounds, decreasing abdominal girth. Here are the options. Option A, passage of stool. The correct answer is option A, passage of stool. Correct answer, passage of stool. Question 60. The nurse is caring for a client with a diagnosis of cirrhosis who is experiencing pruritus. Which of the following is an appropriate nursing intervention? Suggesting that the client take warm showers twice daily, applying a lotion containing menthol or camphor to the skin after bathing, applying powder to the client's skin, placing warm compresses on the affected areas. Here are the options. Option A, applying a lotion containing menthol or camphor to the skin after bathing. The correct answer is option A, Applying a lotion containing menthol or camphor to the skin after bathing. Correct answer. Applying a lotion containing menthol or camphor to the skin after bathing. Question 61. The nurse is caring for a client with a recent laparoscopic hemicolectomy. Which finding should be reported to the physician? Sluggish bowel sounds, pain, and tenderness at the umbilicus passage of small amount of liquid stool increasing abdominal girth. Here are the options. Option A. Increasing abdominal girth. The correct answer is option A. Increasing abdominal girth. Correct answer, increasing abdominal girth. Question 62. The client presents to the emergency room with a hyphema. Which action by the nurse would be appropriate? Elevate the head of the bed and apply ice to the eye. Place the client in a supine position and apply heat to the knee. Insert a Foley catheter and measure the intake and output. Perform a vaginal exam and check for a discharge. Here are the options. Option A. Elevate the head of the bed and apply ice to the eye. The correct answer is option A. Elevate the head of the bed and apply ice to the eye. Correct answer. Elevate the head of the bed and apply ice to the eye. Question 63. The patient is prescribed metronidazole flagyl for adjunct treatment for a duodenal ulcer. When teaching about this medication, the nurse would include, this medication should be taken only until you begin to feel better. This medication should be taken on an empty stomach to increase absorption. While taking this medication, you do not have to be concerned about being in the sun. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Here are the options. Option A. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. The correct answer is option A. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Correct answer. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Question 64. The nurse is evaluating the client's pulmonary artery pressure (PAP). The nurse is aware that PAP evaluates pressure in the left ventricle systolic, diastolic, and mean pressure in the pulmonary artery, pressure in the pulmonary veins, pressure in the right ventricle. Here are the options. Option A. Systolic, diastolic, and mean pressure in the pulmonary artery. The correct answer is option A. Systolic, diastolic, and mean pressure in the pulmonary artery. Correct answer, systolic, diastolic, and mean pressure in the pulmonary artery. Question 65. When assessing the client's blood pressure, the nurse should use a cuff with a width that is blank % of the circumference of the extremity. Fill in the blank. 40,302,010. Here are the options. Option A. 40. The correct answer is option A. 40. Correct answer, 40. Question 66. A client is admitted to the hospital in chronic renal failure. A low-protein diet is ordered. The rationale for a low-protein diet is that a low-protein diet helps reduce blood urea nitrogen and other wastes excreted by the kidneys. A low-protein diet increases the sodium and potassium levels. A low-protein diet increases albumin production. A low-protein diet increases the calcium and phosphorus levels. Here are the options. Option A. A low-protein diet helps reduce blood urea nitrogen and other wastes excreted by the kidneys. The correct answer is option A. A low-protein diet helps reduce blood urea nitrogen and other waste excreted by the kidneys. Correct answer. A low-protein diet helps reduce blood urea nitrogen and other waste excreted by the kidneys. Question 67. Before administering eye drops, the nurse should recognize that it is essential to consider which of the following. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. The patient will be more comfortable if allowed to instill his own eye drops. Eye drops should be instilled with the patient looking down. Eye drops should always be warmed before instilling in the patient's eyes. Here are the options. Option A. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. The correct answer is option A. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. Correct answer. The eye should be cleansed with warm water to remove any exudate before instilling the eye drops. Question 68. A client with cirrhosis is receiving Sefilec lactulose. The nurse is aware that Sefilec is given to lower blood glucose, uric acid, ammonia, creatinine. Here are the options. Option A. Ammonia. The correct answer is option A. Ammonia. Correct answer, ammonia. Question 69. The physician prescribes captopril Capoten 25 mg PO/bid for the client with hypertension. Which of the following adverse reactions can occur with administration of Capoten? Tinnitus, persistent cough, muscle weakness, diarrhea. Here are the options. Option A. Persistent cough. The correct answer is option A. Persistent cough. Correct answer, persistent cough. Question 70. The home health nurse is planning for the day's visits. Which client should be seen first? The client with renal insufficiency, the client with Alzheimer's disease, the client with diabetes who has a decubitus ulcer, the client with multiple sclerosis who is being treated with Roman 4 cortisone. Here are the options. Option A. The client with multiple sclerosis who is being treated with Roman 4 cortisone. The correct answer is option A. The client with multiple sclerosis who is being treated with Roman 4 cortisone. Correct answer. The client with multiple sclerosis who is being treated with Roman 4 cortisone. Question 71. In planning care for the patient with ulcerative colitis, the nurse identifies which nursing diagnosis as a priority. Anxiety, impaired skin integrity, fluid volume deficit, nutrition altered, less than body requirements. Here are the options. Option A. Fluid volume deficit. The correct answer is option A. Fluid volume deficit. Correct answer, fluid volume deficit. Question 72. A nurse indicates that she is licensed in her new state of residence even though reciprocity has not been granted. The nurse's action can result in a charge of fraud, tort, malpractice, negligence. Here are the options. Option A. Fraud. The correct answer is option A. Fraud. Correct answer, fraud. Question 73. Which complaint is frequently expressed by a client with macular degeneration? Problems with activities requiring focused vision, such as sewing, severe eye and face pain accompanied by nausea and vomiting, seeing halos around lights, veil-like loss of vision. Here are the options. Option A. Problems with activities requiring focused vision such as sewing. The correct answer is option A. Problems with activities requiring focused vision such as sewing. Correct answer. Problems with activities requiring focused vision such as sewing. Question 74. When assessing deep tendon reflexes, the nurse grades the client's patellar reflex as a 3+. This reading indicates that the assessed reflex is stronger than normal hypoactive, normal hyperactive. Here are the options. Option A. Stronger than normal. The correct answer is option A. Stronger than normal. Correct answer, stronger than normal. Question 75. A client with a femoral popliteal bypass graft is assigned to a semi-private room. The most suitable roommate for this client is the client with hypothyroidism, diabetic ulcers, gastroenteritis, bacterial pneumonia. Here are the options. Option A. Hypothyroidism. The correct answer is option A. Hypothyroidism. Correct answer, hypothyroidism. Question 76. The client arrives in the emergency department after a motor vehicle accident. Nursing assessment findings include BP 68/34, pulse rate 130, and respirations 18. Which is the client's most appropriate priority nursing diagnosis? Alteration in cerebral tissue perfusion, fluid volume deficit, ineffective airway clearance, alteration in sensory perception. Here are the options. Option A. Fluid volume deficit. The correct answer is option A. Fluid volume deficit. Correct answer, fluid volume deficit. Question 77. The nurse identifies ventricular tachycardia on the cardiac monitor. The patient has a pulse rate of 160 with a regular rhythm. The nurse should give priority to administering atropine sulfate, requesting a stat potassium level, administering amiodarone, defibrillating at 360 joules. Here are the options. Option A. Administering amiodarone. The correct answer is option A. Administering amiodarone. Correct answer, administering amiodarone. Question 78. The nurse is discharging a client with a prescription of eye drops. Which observation by the nurse would indicate a need for further client teaching? Shaking of the suspension to mix the medication, administering a second eye drop medication immediately after the first one was instilled, washing the hands before and after the administration of the drops, holding the lower lid down without pressing the eyeball to instill the drops. Here are the options. Option A. Administering a second eye drop medication immediately after the first one was instilled. The correct answer is option A. Administering a second eye drop medication immediately after the first one was instilled. Correct answer. Administering a second eye drop medication immediately after the first one was instilled. Question 79. The physician has prescribed Novolog as part insulin for a client with diabetes mellitus. Which statement indicates that the client knows when the onset of the insulin occurs? I will make sure I eat breakfast within 10 minutes of taking my insulin. I will need to carry candy or some form of sugar with me all the time. I will eat a snack around 3 o'clock each afternoon. I can save my dessert from supper for a bedtime snack. Here are the options. Option A. I will make sure I eat breakfast within 10 minutes of taking my insulin. The correct answer is option A. I will make sure I eat breakfast within 10 minutes of taking my insulin. Correct answer. I will make sure I eat breakfast within 10 minutes of taking my insulin. Question 80. The client with a history of diabetes insipidus is admitted with polyuria, polydipsia, and mental confusion. The priority intervention for this client is measuring the urinary output, checking the vital signs, encouraging increased fluid intake, weighing the client. Here are the options. Option A, checking the vital signs. The correct answer is option A, checking the vital signs. Correct answer, checking the vital signs. Question 81. The nurse is teaching a client with peritoneal dialysis how to manage exchanges at home. The nurse should tell the client to notify the doctor immediately if the dialysate returns become cloudy in appearance. The return of the dialysate is slower than usual. A tugging sensation is noted as the dialysate drains. A feeling of fullness is felt when the dialysate is instilled. Here are the options. Option A. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. The correct answer is option A. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. Correct answer. The dialysate returns become cloudy in appearance. Indicates infection and impending peritonitis. Question 82. The nurse is caring for a client with diabetes mellitus. Which instruction should be given to the client? Tell the client to avoid stairs. Tell the client to decrease her intake of sodium. Instruct the client to weigh daily. Tell the client to report numbness and tingling in her feet and toes. Here are the options. Option A. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. The correct answer is option A. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. Correct answer. Tell the client to report numbness and tingling in her feet and toes. Diabetic neuropathy. Question 83. A client with myasthenia gravis is admitted in a cholinergic crisis. Signs of cholinergic crisis include decreased blood pressure and constricted pupils, increased heart rate and increased respirations and increased blood pressure, anoxia, and absence of the cough reflex. Here are the options. Option A. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. The correct answer is option A. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. Correct answer. Decreased blood pressure and constricted pupils over medication with anticholinesterase inhibitors. Question 84. The nurse caring for a client with a head injury would recognize which assessment finding as the most indicative of increased ICP? Vomiting, headache, dizziness, papilledema. Here are the options. Option A. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. The correct answer is option A. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. Correct answer. Papilledema causes the part of the optic nerve inside the eye to swell, vision, headache, vomiting. Question 85. On the second postoperative day after a subtotal thyroidectomy, the client tells the nurse, "I feel numbness and my face is twitching." What is the nurse's best initial action? Offer mouth care. Loosen the neck dressing. Notify the physician. Document the finding is the only action. Here are the options. Option A. Notify the physician. Hypocalcemia and symptoms of tetany. The correct answer is option A. Notify the physician. Hypocalcemia and symptoms of tetany. Correct answer. Notify the physician. Hypocalcemia and symptoms of tetany. Question 86. Which statement is true regarding a patient with a Sengstaken-Blakemore tube? The smaller balloon will provide direct pressure to control bleeding from the esophagus. The tube has 4 lumens, one of which drains esophageal secretions. The esophageal balloon should be inflated to a pressure between 30-35 mmHg. Scissors should be kept at the patient's bedside. Here are the options. Option A. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. The correct answer is option A. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. Correct answer. Scissors should be kept at the patient's bedside. To deflate balloons and remove the tube rapidly. Question 87. The nurse is assessing a trauma client in the emergency room when she notes a penetrating abdominal wound with exposed viscera. The nurse should apply a clean dressing to protect the wound. Cover the exposed viscera with a sterile saline gauze. Gently replace the abdominal contents. Cover the area with a petroleum gauze. Here are the options. Option A. Over the exposed viscera with a sterile saline gauze. The correct answer is option A. Over the exposed viscera with a sterile saline gauze. Correct answer. Over the exposed viscera with a sterile saline gauze. Question 88. Which medication should be avoided by the client with acute pancreatitis? Demerol, meperidine, pepsid, famotidine, Zantac, ranitidine, duramorph-morphine sulfate. Here are the options. Option A. Uramorph-morphine sulfate causes spasms of the sphincter of Oddi. The correct answer is option A. Uramorph-morphine sulfate causes spasms of the sphincter of Oddi. Correct answer. Uramorph-morphine sulfate causes spasms of the sphincter of Oddi. Question 89. The nurse is changing the ties of the client with a tracheostomy. The safest method of changing the tracheostomy ties is to apply the new tie before removing the old one. Have a helper present in case assistance is needed. Hold the tracheostomy tie with the non-dominant hand while removing the old tie. Ask the client to hold the tracheostomy in place as the ties are changed. Here are the options. Option A. Apply the new tie before removing the old one. The correct answer is option A. Apply the new tie before removing the old one. Correct answer. Apply the new tie before removing the old one. Question 90. A client is to receive dilantin phenytoin via a nasogastric NG tube. When giving the medication, the nurse should flush the NG tube with 2-4 ml of water before giving the medication. Administer the medication. Flush with 5 ml of water, and clamp the NG tube. Flush the NG tube with 5 ml of normal saline and administer the medication. Flush the NG tube with 2-4 oz of water before and after giving the medication. Here are the options. Option A. Flush the NG tube with 2-4 oz of water before and after giving the medication. The correct answer is option A. Flush the NG tube with 2-4 oz of water before and after giving the medication. Correct answer. Flush the NG tube with 2-4 oz of water before and after giving the medication. Question 91. A client having a colonoscopy is medicated with first midazolam. The nurse recognizes that the client will be able to remember the procedure within 2-3 hours, will not be able to remember having the procedure done, will be able to remember the procedure within 2-3 days, will not be able to remember what occurred before the procedure. Here are the options. Option A. Will not be able to remember having the procedure done versus produces conscious sedation. The correct answer is option A. Will not be able to remember having the procedure done versus produces conscious sedation. Correct answer. Will not be able to remember having the procedure done versus produces conscious sedation. Question 92. The nurse is planning care for a client with adrenal insufficiency. The nurse should give priority to monitoring the client for signs of dehydration, promoting sleep and rest, providing high-calorie snacks, promoting a healthy body image. Here are the options. Option A. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. The correct answer is option A. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. Correct answer. Monitoring the client for signs of dehydration, frequently suffers from fluid volume deficit and acidosis. Question 93. The nurse is assessing a client who had a colon resection 2 days ago. The client states, "I feel like my stitches have burst loose." Upon further assessment, dehiscence of the wound is noted. Which action should the nurse take? Immediately place the client in the prone position. Apply a sterile, saline moistened dressing to the wound. Administer atropine to decrease abdominal secretions. Wrap the abdomen with an AC bandage. Here are the options. Option A. Apply a sterile, saline moistened dressing to the wound. The correct answer is option A. Apply a sterile, saline moistened dressing to the wound. Correct answer. Apply a sterile, saline moistened dressing to the wound. Question 94. The nurse is caring for a client admitted to the emergency room after a fall. X-rays reveal that the client has several fractured bones in the foot. Which treatment should the nurse anticipate for the fractured foot? Application of a walking boot, stabilization with a cast, surgery with Kirschner wire implantation, application of Spica cast. Here are the options. Option A. Stabilization with a cast. The correct answer is option A. Stabilization with a cast. Correct answer. Stabilization with a cast. Question 95. The nurse is preparing a client with gastroesophageal reflux disease cured for discharge. The nurse should tell the client to eat a small snack before bedtime, sleep on his right side, avoid carbonated beverages, increase his intake of citrus fruits. Here are the options. Option A. Avoid carbonated beverages. The correct answer is option A. Avoid carbonated beverages. Correct answer. Avoid carbonated beverages. Question 96. The nurse is performing discharge teaching on a client with ulcerative colitis who has been placed on a low-residue diet. Which food would need to be eliminated from this client's diet? Roasted chicken noodles, cooked broccoli, roast beef. Here are the options. Option A. Cooked broccoli. The correct answer is option A. Cooked broccoli. Correct answer. Cooked broccoli. Question 97. While caring for a client with cervical cancer, the nurse notes that the radioactive implant is lying in the bed. The nurse should place the implant in a biohazard bag and return it to the lab. Give the client a pair of gloves and ask her to reinsert the implant. Use tongs to pick up the implant and return it to a lead-lined container. Discard the implant in the commode and double flush. Here are the options. Option A. Use tongs to pick up the implant and return it to a lead-lined container. The correct answer is option A. Use tongs to pick up the implant and return it to a lead-lined container. Correct answer. Use tongs to pick up the implant and return it to a lead-lined container. Question 98. A client with Parkinson's disease is scheduled for stereotactic surgery. Which finding indicates that the surgery had its intended effect? The client no longer has intractable tremors. The client has sufficient production of dopamine. The client no longer requires any medication. The client will have increased production of serotonin. Here are the options. Option A. The client no longer has intractable tremors. The correct answer is option A. The client no longer has intractable tremors. Correct answer. The client no longer has intractable tremors. Question 99. The physician has ordered a homocysteine blood level on a client. The nurse recognizes that the results will be increased in a client with a deficiency in which of the following? Vitamin B12, vitamin C, vitamin E. Here are the options. Option A. Vitamin B12 increased when a client has B12 deficiency. The correct answer is option A. Vitamin B12 increased when a client has B12 deficiency. Correct answer. Vitamin B12 increased when a client has B12 deficiency. Question 100. Which obstetrical client is most likely to have an infant with respiratory distress syndrome? A 28-year-old with a history of alcohol use during the pregnancy, a 24-year-old with a history of diabetes mellitus, a 30-year-old with a history of smoking during the pregnancy, a 32-year-old with a history of pregnancy-induced hypertension. Here are the options. Option A. A 24-year-old with a history of diabetes mellitus. The correct answer is option A. A 24-year-old with a history of diabetes mellitus. Correct answer. A 24-year-old with a history of diabetes mellitus. Question 101. A client with a C4 spinal cord injury has been placed in traction with cervical tongs. Nursing care should include releasing the traction for 5 minutes each shift, loosening the pins if the client complains of headache, elevating the head of the bed 90 degrees, performing sterile pin care as ordered. Here are the options. Option A. Performing sterile pin care as ordered. The correct answer is option A. Performing sterile pin care as ordered. Correct answer. Performing sterile pin care as ordered. Question 102. The nurse has been teaching the role of diet in regulating blood pressure to a client with hypertension. Which meal selection indicates the client understands his new diet? Cornflakes, whole milk, banana and coffee, scrambled eggs, bacon, toast and coffee, oatmeal, apple juice, dry toast and coffee, pancakes, ham, tomato juice and coffee. Here are the options. Option A. Oatmeal, apple juice, dry toast and coffee. The correct answer is option A. Oatmeal, apple juice, dry toast and coffee. Correct answer. Oatmeal, apple juice, dry toast and coffee. Question 103. The nurse is caring for a child in a plaster of Paris hip spica cast. To facilitate drying, the nurse should use a small handheld hair dryer set on medium heat. Place a small heater near the child's bed. Turn the child at least every 2 hours. Allow one side to dry before changing positions. Here are the options. Option A. Turn the child at least every 2 hours. The correct answer is option A. Turn the child at least every 2 hours. Correct answer. Turn the child at least every 2 hours. Question 104. A client is admitted with kidney disease. Which type of intravenous fluid is likely to be ordered for this client? Hypertonic, isotonic, colloid, hypotonic. Here are the options. Option A. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. The correct answer is option A. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. Correct answer. Isotonic solutions such as 0.9% sodium chloride and lactated ringers. Question 105. Which of the following statements is true regarding management of the client with multiple sclerosis? Taking a hot bath will decrease stiffness and spasticity. A schedule of strenuous exercise will improve muscle strength. Rest periods should be scheduled throughout the day. Visual disturbances can be corrected with prescription glasses. Here are the options. Option A. Rest periods should be scheduled throughout the day. The correct answer is option A. Rest periods should be scheduled throughout the day. Correct answer. Rest periods should be scheduled throughout the day. Question 106. The nurse is preparing to administer regular insulin by continuous Roman-4 infusion to a client with diabetic ketoacidosis. The nurse should mix the insulin with dextrose 5% in water. Flush the Roman-4 tubing with the insulin solution and discard the first 50 ml. Avoid using a pump or controller with the infusion. Mix the insulin with Ringer's lactate. Here are the options. Option A. Flush the Roman-4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. The correct answer is option A. Flush the Roman-4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. Correct answer. Flush the Roman-4 tubing with the insulin solution and discard the first 50 ml. Insulin molecules adhere to glass and plastic. Question 107. The nurse is caring for a client with possible cervical cancer. What clinical data would the nurse most likely find in the client's history? Postcoital vaginal bleeding, nausea and vomiting, foul-smelling vaginal discharge, elevated temperature levels. Here are the options. Option A. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. The correct answer is option A. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. Correct answer. Postcoital vaginal bleeding. Spotting is a common symptom of cervical cancer. Question 108. The nurse is caring for a client with amyotrophic lateral sclerosis ALS, Lou Gehrig's disease. The nurse should give priority to assessing the client's respiratory status, providing an alternate means of communication, referring the client and family to community support groups, instituting a routine of active range of motion exercises. Here are the options. Option A. Assessing the client's respiratory status. The correct answer is option A. Assessing the client's respiratory status. Correct answer. Assessing the client's respiratory status. Question 109. The physician has prescribed nitroglycerin sublingual tablets as needed for a client with angina. The nurse should tell the client to take the medication after engaging in strenuous activity every 4 hours to prevent chest pain as soon as he notices signs of chest pain at bedtime to prevent nocturnal angina. Here are the options. Option A. As soon as he notices signs of chest pain. The correct answer is option A. As soon as he notices signs of chest pain. Correct answer. As soon as he notices signs of chest pain. Question 110. A client is admitted to the emergency department with a loss of consciousness with a known etiology. The nurse expects to perform which laboratory test to assist in determining etiology? Total cholesterol alkaline phosphatase serum glucose urinalysis. Here are the options. Option A. Serum glucosis in determining the cause of the loss of consciousness. The correct answer is option A. Serum glucosis in determining the cause of the loss of consciousness. Correct answer. Serum glucosis in determining the cause of the loss of consciousness. Question 111. The home health nurse is visiting a 30-year-old with sickle cell disease. Assessment findings include splenomegaly. What information obtained on the visit would cause the most concern? The client eats fast food daily for lunch, drinks a beer occasionally, sometimes feels fatigued, works as a furniture mover. Here are the options. Option A. Works as a furniture mover. The correct answer is option A. Works as a furniture mover. Correct answer. Works as a furniture mover. Question 112. The nurse is caring for a client with a head injury who has an intracranial pressure monitor in place. Assessment reveals an ICP reading of 66. What is the nurse's best action? Notify the physician. Record the reading is the only action. Turn the client and recheck the reading. Place the client supine. Here are the options. Option A. Notify the physician. Normal ICP is 10-20. A reading of 66 is high. The correct answer is option A. Notify the physician. Normal ICP is 10-20. A reading of 66 is high. Correct answer. Notify the physician. Normal ICP is 10-20. A reading of 66 is high. Question 113. The nurse is completing the preoperative checklist on a client scheduled for surgery and finds that the consent form has been signed, but the client is unclear about the surgery and possible complications. Which is the most appropriate action? Call the surgeon and ask him to come see the client to clarify the information. Explain the procedure and complications to the client. Check in the physician's progress notes to see if understanding has been documented. Check with the client's family to see if they understand the procedure fully. Here are the options. Option A. Call the surgeon and ask him to come see the client to clarify the information. The correct answer is option A. Call the surgeon and ask him to come see the client to clarify the information. Correct answer. Call the surgeon and ask him to come see the client to clarify the information. Question 114. 4 clients are to receive medication. Which client should receive medication first? A client with an apical pulse of 72 receiving Lanax and Digoxin PO daily. A client with abdominal surgery receiving Phenergan promethazine IM every 4 hours PRN for nausea and vomiting. A client with labored respirations receiving a stat dose of Roman 4 Lasix furosemide. A client with pneumonia receiving polycillin ampicillin IFP every 6 hours. Here are the options. Option A. A client with labored respirations receiving a stat dose of Roman 4-6 furosemide. The correct answer is option A. A client with labored respirations receiving a stat dose of Roman 4-6 furosemide. Correct answer. A client with labored respirations receiving a stat dose of Roman 4-6 furosemide. Question 115. The nurse is planning the diet of a client who is recovering from acute pancreatitis. The nurse should select foods that are high in carbohydrate and protein, low in sodium, but high fat, high in protein, and sodium, low in fat and low protein. Here are the options. Option A. Low in fat and low protein. The correct answer is option A. Low in fat and low protein. Correct answer. Low in fat and low protein. Question 116. A client with congestive heart failure has been receiving Digix and Laxixin. Which finding indicates that the medication is having a desired effect? Increased urinary output, stabilized weight, improved appetite, increased pedal edema. Here are the options. Option A. Increased urinary output. Laxixin slows and strengthens the contraction of the heart. The correct answer is option A. Increased urinary output. Laxixin slows and strengthens the contraction of the heart. Correct answer. Increased urinary output. Laxixin slows and strengthens the contraction of the heart. Question 117. The physician has ordered 2 units of whole blood for a client following surgery. To provide for client safety, the nurse should obtain a signed permit for each unit of blood. Use a new administration set for each unit transfused. Administer the blood using a Y connector. Check the blood type and RH factor 3 times before initiating the transfusion. Here are the options. Option A. Check the blood type and RH factor 3 times before initiating the transfusion. The correct answer is option A. Check the blood type and RH factor 3 times before initiating the transfusion. Correct answer. Check the blood type and RH factor 3 times before initiating the transfusion. Question 118. During the change of shift report, a nurse writes in her notes that she suspects illegal drug use by a client assigned to her care. During the shift, the notes are found by the client's daughter. The nurse could be sued for libel, slander, malpractice, negligence. Here are the options. Option A. Libel. The correct answer is option A. Libel. Correct answer. Libel. Question 119. The registered nurse is making shift assignments. Which client should be assigned to the licensed practical nurse LPN? A client who is a diabetic with a foot ulcer, a client with a deep vein thrombosis receiving intravenous heparin, a client being weaned from a tracheostomy, a post-operative cholecystectomy with a T-tube. Here are the options. Option A. A client who is a diabetic with a foot ulcer. The correct answer is option A. A client who is a diabetic with a foot ulcer. Correct answer. A client who is a diabetic with a foot ulcer. Question 120. A client is admitted with sickle cell crises and sequestration. Upon assessing the client, the nurse would expect to find decreased blood pressure, moist mucous membranes, decreased respirations, increased blood pressure. Here are the options. Option A. Decreased blood pressure will have signs of hypovolemia, including decreased blood pressure. The correct answer is option A. Decreased blood pressure will have signs of hypovolemia. including decreased blood pressure. Correct answer. Decreased blood pressure will have signs of hypovolemia, including decreased blood pressure. Question 121. The nurse knows that a client with right-sided hemiplegia understands teaching regarding ambulation with a cane if she states, "I will hold the cane in my right hand. I will advance my cane and my right leg at the same time. I will be able to walk only by using a walker. I will hold the cane in my left hand." Here are the options. Option A. I will hold the cane in my left hand. The correct answer is option A. I will hold the cane in my left hand. Correct answer. I will hold the cane in my left hand. Question 122. The nurse is conducting a physical assessment on a client with mild anemia. Which of the following would the nurse expect to observe? Heart murmur, increased respiratory rate, activity intolerance, frequent respiratory infections. Here are the options. Option A. Increased respiratory rate. The correct answer is option A. Increased respiratory rate. Correct answer. Increased respiratory rate. Question 123. A client with angina is experiencing migraine headaches. The physician has prescribed sumatriptan 6 and 8 Imitrex. Which nursing action is most appropriate? Call the physician to question a prescription order. Try to obtain samples for the client to take home. Perform discharge teaching regarding this drug. Consult social services for financial assistance with obtaining the drug. Here are the options. Option A. All the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictive effects systemically contraindicated in PTS with angina. The correct answer is option A. All the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictive effects systemically contraindicated in PTS with angina. Correct answer. All the physician to question the prescription order. Imitrex results in cranial vasoconstriction to reduce pain, but it can also cause vasoconstrictive effects systemically contraindicated in PTS with angina. Question 124. The nurse is assessing a client hospitalized with a duodenal ulcer. Which findings should be reported to the doctor immediately? BP 82/60, pulse 120, pulse 68, respirations 24, BP 110/88, pulse 56, pulse 82, respirations 16. Here are the options. Option A. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. The correct answer is option A. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. Correct answer. BP 82/60. Pulse 120, decreased BP and increased pulse are associated with bleeding and shock. Question 125. Which statement made by the family member caring for the client with a percutaneous gastrostomy tube indicates understanding of the nurse's teaching? I must flush the tube with water after feedings and clamp the tube. I must check placement 4 times per day. I will report to the doctor any signs of indigestion. If my father is unable to swallow, I will discontinue the feeding and call the clinic. Here are the options. Option A. I must flush the tube with water after feedings and clamp the tube. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Correct answer. I must flush the tube with water after feedings and clamp the tube. Question 126. The nurse is caring for a client following the reimplantation of the thumb and index finger. Which finding should be reported to the physician immediately? Temperature of 100 degrees F, coolness and discoloration of the digits, complaints of pain, difficulty moving the digits. Here are the options. Option A, coolness and discoloration of the digits. The correct answer is option A, coolness and discoloration of the digits. Correct answer, coolness and discoloration of the digits. Question 127. The nurse is caring for a client with full thickness burns to the lower half of the torso and lower extremities. During the emergent phase of injury, the primary nursing diagnosis would focus on imbalanced nutrition, less than body requirements related to hypermetabolic state, risk for infection related to altered skin integrity, risk for fluid volume imbalance related to intracompartmental fluid shift, acute pain related to burn injury. Here are the options. Option A, risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. The correct answer is option A, risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. Correct answer, risk for fluid volume imbalance related to intracompartmental fluid shift, emergent phase. Question 128. A client with rheumatoid arthritis is receiving injections of meocresine gold sodium thiomalate. Before administering the client's medication, the nurse should check the lab work, administer an antiemetic, obtain the blood pressure, administer a sedative. Here are the options. Option A, check the lab work. Gold salts are toxic to the kidneys and the bone marrow. The correct answer is option A, check the lab work. Gold salts are toxic to the kidneys and the bone marrow. Correct answer, check the lab work. Gold salts are toxic to the kidneys and the bone marrow. Question 129. Which finding is associated with secondary syphilis? Painless papular lesions on the perineum, fingers, and eyelids, absence of lesions, deep asymmetrical granulomatous lesions, well-defined generalized lesions on the palms, soles, and perineum. Here are the options. Option A, well-defined generalized lesions on the palms, soles, and perineum. The correct answer is option A, well-defined generalized lesions on the palms, soles, and perineum. Correct answer, well-defined generalized lesions on the palms, soles, and perineum. Question 130. The nurse is caring for a client with Lyme's disease. The nurse should carefully monitor the client for signs of neurological complications, which include complaints of a drawing sensation and paralysis on one side of the face, presence of an unsteady gait, intention tremor, and facial weakness, complaints of excruciating facial pain brought on by talking, smiling, or eating, presence of fatigue when talking, dysphagia, and involuntary facial twitching. Here are the options. Option A, complaints of a drawing sensation and paralysis on one side of the face. The correct answer is option A, complaints of a drawing sensation and paralysis on one side of the face. Correct answer, complaints of a drawing sensation and paralysis on one side of the face. Question 131. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? Place the client in Trendelenburg position for postural drainage. Encourage coughing and deep breathing every 2 hours. Elevate the head of the bed 30 degrees. Encourage the client to gently blow the nose every 2 hours to remove secretions. Here are the options. Option A. Elevate the head of the bed 30 degrees. A prolactinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. The correct answer is option A. Elevate the head of the bed 30 degrees. A prolactinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. Correct answer. Elevate the head of the bed 30 degrees. A prolactinoma is a type of pituitary tumor. 30 degrees decreases the ICP and reduces risk of CSF leaks. Question 132. A client is hospitalized with signs of transplant rejection following a recent renal transplant. Assessment of the client would be expected to reveal a weight loss of 2 pounds in 1 day, a serum creatinine 1.25 mg/dl, urinary output of 50 ml/hr, rising blood pressure. Here are the options. Option A. Rising blood pressure, increased BP following renal transplant is an early sign of transplant failure. The correct answer is option A. Rising blood pressure, increased BP following renal transplant is an early sign of transplant failure. Correct answer. Rising blood pressure, increased BP following renal transplant is an early sign of transplant failure. Question 133. A client with diabetes insipidus is receiving desmopressin acetate. Which lab finding indicates that the medication is having its intended effect? Blood glucose 92 mg/dl, urine specific gravity 1.0, 2 white blood count of 7, 500 glycosylated hemoglobin 3.5 mg/dl. Here are the options. Option A. Urine specific gravity 1.20. The correct answer is option A. Urine specific gravity 1.20. Correct answer. Urine specific gravity 1.020. Question 134. The nurse would identify which one of the following assessment findings as a normal response in a craniotomy client postoperatively? A decrease in responsiveness the third post-op day, sluggish pupil reaction the first 24-48 hours, dressing changes 3 to 4 times a day for the first 3 days, temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Here are the options. Option A. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. The correct answer is option A. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Correct answer. Temperature range of 98.8 degrees F to 99.6 degrees F the first 2-3 days. Question 135. The physician has ordered intubation and mechanical ventilation for a client with periods of apnea following a closed head injury. Arterial blood gases reveal a pH of 7.47, PCO2 of 28, and HCO3 of 23. These findings indicate that the client has respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Here are the options. Option A. Respiratory alkalosis. The correct answer is option A. Respiratory alkalosis. Correct answer. Respiratory alkalosis. Question 136. Which one of the following symptoms is common in the client with duodenal ulcers? vomiting shortly after eating, epigastric pain following meals, frequent bouts of diarrhea, presence of blood in the stools. Here are the options. Option A. Presence of blood in the stools. The correct answer is option A. Presence of blood in the stools. Correct answer. Presence of blood in the stools. Question 137. A nurse is working in an endoscopy recovery area. Many of the clients are administered midazolam versed to provide conscious sedation. Which medication is important to have available as an antidote for VERST? Diazepam, Valium, naloxone, Narcan, Flumazenil, Romazepam, Fluorine, Fludrocortisone. Here are the options. Option A. Lumazenil, Romazepam. The correct answer is option A. Lumazenil, Romazepam. Correct answer. Lumazenil, Romazepam. Question 138. The nurse has just received the change of shift report. Which client should the nurse assess first? A client with a supratentorial tumor awaiting surgery, a client admitted with a suspected subdural hematoma, a client recently diagnosed with akinetic seizures, a client transferring to the neurorehabilitation unit. Here are the options. Option A. A client admitted with a suspected subdural hematoma. The correct answer is option A. A client admitted with a suspected subdural hematoma. Correct answer. A client admitted with a suspected subdural hematoma. Question 139. The nurse caring for a client in shock recognizes that the glomerular filtration rate of the kidneys will fail if the client's mean arterial pressure falls below which of the following levels? 14 billion, 12 million, 10,000, 80. Here are the options. Option A. AD. The correct answer is option A. 80. Correct answer. 80. Question 140. The nurse is caring for a patient hospitalized with leukopenia. Which of the following assessments should be reported to the physician immediately? The blood pressure is 110/62. The apical pulse is 90. The temperature has increased from 98.6 degrees F to 99.8 degrees F. The respiratory rate is 24. Here are the options. Option A. The temperature has increased from 98.6 degrees F to 99.8 degrees F. The correct answer is option A. The temperature has increased from 98.6 degrees F to 99.8 degrees F. Correct answer. The temperature has increased from 98.6 degrees F to 99.8 degrees F. Question 141. A client with chronic obstructive pulmonary disease (COPD) is admitted to the respiratory unit. Which physician prescription should the nurse question? O2 at 5L/min. I nasal cannula Solumedrol 125 mg Roman 4 push every 6 hours. Ceftriaxone Rosin 1 gram IV daily. Darvocet N100 Purine pain. Here are the options. Option A. O2 at 5L/min by nasal cannula. The correct answer is option A. O2 at 5L/min by nasal cannula. Correct answer. O2 at 5L/min by nasal cannula. Question 142. A client with cystic fibrosis is taking pancreatic enzymes. The nurse should administer this medication once per day in the morning, 3 times per day, with meals once per day, at bedtime 4 times per day. Here are the options. Option A. 3 times per day with meals. The correct answer is option A. 3 times per day with meals. Correct answer. 3 times per day with meals. Question 143. The client is admitted for an open reduction internal fixation of a fractured hip. Immediately following surgery, the nurse should give priority to assessing the serum collection Davol drain client's pain nutritional status immobilizer. Here are the options. Option A. Serum collection Davol drain. The correct answer is option A. Serum collection Davol drain. Correct answer. Serum collection Davol drain. Question 144. A client hospitalized with MRSA is placed on contact precautions. Which statement is true regarding precautions for infection spread by contact? The client should be placed in a room with negative pressure. Infection requires close contact, therefore, the door may remain open. Transmission is highly likely, so the client should wear a mask at all times. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Here are the options. Option A. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. The correct answer is option A. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Correct answer. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and a gown. Question 145. The nurse is caring for a client following a laryngectomy. The nurse can best help the client with communication by providing a pad and pencil, checking on him every 30 minutes, telling him to use the call light, teaching the client simple sign language. Here are the options. Option A. Providing a pad and pencil. The correct answer is option A. Providing a pad and pencil. Correct answer. Providing a pad and pencil. Question 146. The nurse is preparing a client for discharge following the removal of a cataract. The nurse should tell the client to take aspirin for discomfort, avoid bending over to put on his shoes, remove the eye shield before going to sleep, continue showering as usual. Here are the options. Option A. Avoid bending over to put on his shoes. The correct answer is option A. Avoid bending over to put on his shoes. Correct answer. Avoid bending over to put on his shoes. Question 147. A client is admitted to the intensive care unit after falling on an icy sidewalk and striking the right side of the head. An MRI revealed a right-sided epidural hematoma. Which physical force explains the location of the client's injury? Coup contra coup, deceleration, acceleration. Here are the options. Option A. Coup type of injury occurs when the brain damage is directly under the site of impact. The correct answer is option A. Coup type of injury occurs when the brain damage is directly under the site of impact. Correct answer. Coup type of injury occurs when the brain damage is directly under the site of impact. Question 148. The nurse is assessing the heart sounds of a client with mitral stenosis following a history of rheumatic fever. To hear a mitral murmur, the nurse should place the stethoscope at the third intercostal space right of the sternum, the third intercostal space left of the sternum, the fourth intercostal space beneath the sternum, the fourth intercostal space midclavicular line. Here are the options. Option A. The fourth intercostal space midclavicular line. The correct answer is option A. The fourth intercostal space midclavicular line. Correct answer. The fourth intercostal space midclavicular line. Question 149. A client is admitted with symptoms of vertigo and syncope. Diagnostic tests indicate left subclavian artery obstruction. What additional findings would the nurse expect? Memory loss and disorientation, numbness in the face, mouth, and tongue, radial pulse differences over 10 bpm, frontal headache with associated nausea or emesis. Here are the options. Option A. Radial pulse differences over 10 bpm. The correct answer is option A. Radial pulse differences over 10 bpm. Correct answer. Radial pulse differences over 10 bpm. Question 150. An elderly female is admitted with a fractured right femoral neck. Which clinical manifestation would the nurse expect to find? Free movement of the right leg, abduction of the right leg, internal rotation of the right hip, shortening of the right leg. Here are the options. Option A. Shortening of the right leg. The correct answer is option A. Shortening of the right leg. Correct answer. Shortening of the right leg. Question 151. A client hospitalized with renal calculi complains of severe pain in the right flank. In addition to complaints of pain, the nurse can expect to see changes in the client's vital signs that include decreased pulse rate, increased blood pressure, decreased respiratory rate, increased temperature. Here are the options. Option A. Increased blood pressure. The correct answer is option A. Increased blood pressure. Correct answer. Increased blood pressure. Question 152. The nurse is caring for a client hospitalized with a facial stroke. Which diet selection would be suited to the client? Roast beef sandwich, potato chips, pickle spear, iced tea, split pea soup, mashed potatoes, pudding, milk tomato soup, cheese toast, gelatin, coffee, hamburger, baked beans, fruit cup, iced tea. Here are the options. Option A. Split pea soup, mashed potatoes, pudding, milk. The correct answer is option A. Split pea soup, mashed potatoes, pudding, milk. Correct answer. Split pea soup, mashed potatoes, pudding, milk. Question 153. The physician has ordered Zyvox linezolid for a patient diagnosed with vancomycin-resistant Enterococcus. Which food should be avoided? Wheat bread, honey, oranges, aged cheese. Here are the options. Option A. Aged cheese. The correct answer is option A. Aged cheese. Correct answer. Aged cheese. Question 154. The nurse is preparing a client for surgery. Which lab finding should be reported to the physician? Potassium 2.5 nm/L, hemoglobin 14.5 d/dL, blood glucose 75 mg/dL, white cell count 8 mm3. Here are the options. Option A. Potassium 2.5 mx/L. The correct answer is option A. Potassium 2.5 mx/L. Correct answer. Potassium 2.5 mx/L. Question 155. A patient refuses to take his dose of oral medication. The nurse tells the patient that if he does not take the medication, that she will administer it by injection. The nurse's comments can result in a charge of malpractice, assault, negligence, battery. Here are the options. Option A. Assault. The correct answer is option A. Assault. Correct answer, assault. Question 156. The primary cause of anemia in a client with chronic renal failure is poor iron absorption, destruction of red blood cells, lack of intrinsic factor, insufficient erythropoietin. Here are the options. Option A, insufficient erythropoietin. The correct answer is option A, insufficient erythropoietin. Correct answer, insufficient erythropoietin. Question 157. A client with tuberculosis who has been on combined therapy with rifampin, rifampin, and INH isoniazid asks the nurse how long he will have to take medication. The nurse should tell the client that medication is rarely needed after 2 weeks. He will need to take medication the rest of his life. The course of combined therapy is usually 6 months. Here are the options. Option A. The course of combined therapy is usually 6 months. The correct answer is option A. The course of combined therapy is usually 6 months. Correct answer. The course of combined therapy is usually 6 months. Question 158. A client with severe anemia is to receive a unit of packed red blood cells. In the event of a transfusion reaction, the first action by the nurse should be to notify the physician and the nursing supervisor, stop the transfusion and maintain an Roman 4 of normal saline, call the lab for verification of type and cross-match, prepare an injection of Benadryl diphenhydramine. Here are the options. Option A. Stop the transfusion and maintain an Roman 4 of normal saline. The correct answer is option A. Stop the transfusion and maintain an Roman 4 of normal saline. Correct answer. Stop the transfusion and maintain an Roman 4 of normal saline. Question 159. The nurse is caring for the client receiving amphotericin B. Which of the following indicates that the client has experienced toxicity to this drug? Changes in vision, nausea, urinary frequency, changes in skin color. Here are the options. Option A. Changes in skin color, liver toxicity in the client taking Abelset amphotericin B. The correct answer is option A. Changes in skin color, liver toxicity in the client taking Abelset amphotericin B. Correct answer. Changes in skin color, liver toxicity in the client taking Abelset amphotericin B. Question 160. Nimodipine Nimotop is ordered for the client with a ruptured cerebral aneurysm. What does the nurse recognize as a desired effect of this drug? Prevent the influx of calcium into cells. Restore a normal blood pressure reading. Prevent the inflammatory process. Dissolve the clot that has formed. Here are the options. Option A. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. The correct answer is option A. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. Correct answer. Prevent the influx of calcium into cells. Calcium channel blocker and is used to prevent calcium influx. Question 161. A client hospitalized with AIDS tells the nurse that he has been exposed to measles. The nurse should contact the physician regarding an order for an antibiotic, immunoglobulin, and antiviral airborne isolation. Here are the options. Option A. Immunoglobulin. The correct answer is option A. Immunoglobulin. Correct answer, immunoglobulin. Question 162. A burn client is in the acute phase of burn care. The nurse assesses jugular vein distension, edema, urine output of 20 ml in 2 hours, and crackles on auscultation. Which order would the nurse anticipate from the physician? Furosemide Lasix 40 mg Roman 4 push irrigate the Foley catheter, increase the Roman 4 fluids to 200 ml/hr, place the client in Trendelenburg position. Here are the options. Option A, Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. The correct answer is option A. Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. Correct answer. Furosemide Lasix 40 mg Roman 4 push suspect CHF and anticipate an order for a diuretic to remove excess fluid. Question 163. The nurse is caring for a client with a radium implant for the treatment of cervical cancer. While caring for the client with a radioactive implant, the nurse should provide emotional support by spending additional time with the client. Stand at the foot of the bed when talking to the client. Avoid handling items used by the client. Wear a badge to monitor the amount of time spent in the client's room. Here are the options. Option A. Wear a badge to monitor the amount of time spent in the client's room. The correct answer is option A. Wear a badge to monitor the amount of time spent in the client's room. Correct answer. Wear a badge to monitor the amount of time spent in the client's room. Question 164. The physician is preparing to remove a central line. The nurse should tell the client to breathe normally, take slow, deep breaths, take a deep breath and hold it, breathe as quickly as possible. Here are the options. Option A. Take a deep breath and hold it. The correct answer is option A. Take a deep breath and hold it. Correct answer. Take a deep breath and hold it. Question 165. A client who uses a respiratory inhaler asks the nurse to explain how he can know when half his medication is empty so that he can refill his prescription. The nurse should tell the client to shake the inhaler and listen for the contents. Drop the inhaler in water to see if it floats. Check for a hissing sound as the inhaler is used. Press the inhaler and watch for the mist. Here are the options. Option A. Drop the inhaler in water to see if it floats. The correct answer is option A. Drop the inhaler in water to see if it floats. Correct answer. Drop the inhaler in water to see if it floats. Question 166. A client is admitted with a ruptured spleen following a four-wheeler accident. In preparation for surgery, the nurse suspects that the client is in the compensatory stage of shock because of which clinical manifestation? Blood pressure 120/70, confusion, heart rate 120, crackles on chest, auscultation, mottled skin, lethargy, jaundice, urine output less than 30 ml in the past hour, heart rate 170, rapid shallow respirations, unconscious, petechiae anterior chest. Here are the options. Option A. Blood pressure 120/70, confusion, heart rate 120, compensatory stage of shock, BP remains normal. The correct answer is option A. Blood pressure 120/70, confusion, heart rate 120, compensatory stage of shock, BP remains normal. Correct answer. Blood pressure 120/70, confusion, heart rate 120, compensatory stage of shock, BP remains normal. Question 167. A nurse is caring for a client with a myocardial infarction. The nurse recognizes that the most common complication in the client following a myocardial infarction is right ventricular hypertrophy, cardiac dysrhythmia, left ventricular hypertrophy, hyperkalemia. Here are the options. Option A, cardiac dysrhythmia. The correct answer is option A, cardiac dysrhythmia. Correct answer, cardiac dysrhythmia. Question 168. Which of the following statements best explains the rationale for placing the client in Trendelenburg position during the insertion of a central line catheter? It will facilitate catheter insertion. It will make the client more comfortable during the insertion. It will prevent the occurrence of ventricular tachycardia. It will prevent the development of pulmonary embolus. Here are the options. Option A, it will facilitate catheter insertion. The correct answer is option A, it will facilitate catheter insertion. Correct answer, it will facilitate catheter insertion. Question 169. A client is admitted to the emergency department with complaints of crushing chest pain that radiates to the left jaw. After obtaining a stat electrocardiogram, the nurse should obtain a history of prior cardiac problems, begin and Roman 4 using a large bore catheter, administer oxygen at 2 L per minute via nasal cannula, perform pupil checks for size and reaction to light. Here are the options. Option A, administer oxygen at 2 L per minute via nasal cannula. The correct answer is option A, administer oxygen at 2 L per minute via nasal cannula. Correct answer, administer oxygen at 2 L per minute via nasal cannula. Question 170. The nurse is caring for a client following a myocardial infarction. Which of the following enzymes are specific to cardiac damage? SCOT and LDH, SCOT and CKBB, LDH and CKMB, LDH and CKBB. Here are the options. Option A, LDH and CKMB specific for diagnosing cardiac damage. The correct answer is option A, LDH and CKMB specific for diagnosing cardiac damage. Correct answer, LDH and CKMB specific for diagnosing cardiac damage. Question 171. A burn client's care plan reveals an expected outcome of no localized or systemic infection. Which assessment by the nurse supports this outcome? Wound culture results showing minimal, bacteria cloudy, foul-smelling urine, white blood cell count of 14, 0/mm3 temperature elevation of 101 degrees F. Here are the options. Option A, wound culture results showing minimal bacteria. The correct answer is option A, wound culture results showing minimal bacteria. Correct answer, wound culture results showing minimal bacteria. Question 172. The home health nurse is visiting a client with an exacerbation of rheumatoid arthritis. To prevent deformities of the knee joints, the nurse should tell the client to walk without bending the knees, encourage movement within the limits of pain, instruct the client to sit only in a recliner, tell the client to remain in bed as long as the joints are painful. Here are the options. Option A, encourage movement within the limits of pain. The correct answer is option A, encourage movement within the limits of pain. Correct answer, encourage movement within the limits of pain. Question 173. The nurse is caring for a client with cancer of the pancreas. Which finding indicates involvement of the bile ducts? dark urine piteki dark stools steatorrhea. Here are the options. Option A. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in the client with pancreatic cancer. The correct answer is option A. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in the client with pancreatic cancer. Correct answer. Dark urine, clay-colored stools, jaundice, and pruritus indicate involvement of bile ducts in the client with pancreatic cancer. Question 174. The client has an order for sliding scale insulin at 19 hours and lantusclargin insulin at the same hour. The nurse should administer the two medications together, administer the medications in 2 injections, draw up the lantus insulin and then the regular insulin and administer them together. Contact the doctor because these medications should not be given to the same client. Here are the options. Option A. Administer the medications in 2 injections. The correct answer is option A. Administer the medications in 2 injections. Correct answer. Administer the medications in 2 injections. Question 175. The nurse should carefully monitor the client for which common dysrhythmia that can occur during suctioning? Bradycardia, tachycardia, ventricular ectopic beat 6 sinus syndrome. Here are the options. Option A. Bradycardia. The correct answer is option A. Bradycardia. Correct answer. Bradycardia. Question 176. A client with rheumatoid arthritis has Sjogren's syndrome. The nurse can help relieve the symptoms of Sjogren's syndrome by providing heat to the joints, instilling eye drops, administering pain medication, providing small, frequent meals. Here are the options. Option A. Instilling eye drops to eyes. The correct answer is option A. Instilling eye drops to eyes. Correct answer. Instilling eye drops to eyes. Question 177. A client has developed diabetes insipidus after removal of a pituitary tumor. Which finding would the nurse expect? Polyuria, hypertension, polyphagia, hyperkalemia. Here are the options. Option A. Polyuria. The correct answer is option A. Polyuria. Correct answer. Polyuria. Question 178. The nurse is evaluating teaching effectiveness on a client with a gastrointestinal disorder prescribed a gluten-free diet. Which diet choice indicates that the client understands the instructions given? Steamed broccoli, wheat toast, chocolate chip cookie bran cereal. Here are the options. Option A. Steamed broccoli. The correct answer is option A. Steamed broccoli. Correct answer. Steamed broccoli. Question 179. A client with pneumocystis gyropsypneumonia is receiving intravenous pentamidine. While administering the medication, the nurse should give priority to checking the client's deep tendon reflexes, blood pressure, urine output, tissue turgor. Here are the options. Option A. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. The correct answer is option A. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. Correct answer. Blood pressure if infused too rapidly can cause severe hypotension and hypoglycemia. Question 180. A client with COPD is in respiratory failure. Which of the following results would be the most sensitive indicator that the client requires a mechanical ventilator? PCO2 58 SAW 029 pH 7.23 HCO 330. Here are the options. Option A, pH 7.23. The correct answer is option A, pH 7.23. Correct answer, pH 7.23. Question 181. An elderly client with glaucoma has been prescribed Timoptic timolol eye drops. Timoptic should be used with caution in clients with a history of diabetes, gastric ulcers, emphysema, pancreatitis. Here are the options. Option A, emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. The correct answer is option A. Emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. Correct answer. Emphysema beta blockers such as timolol Timoptic can cause bronchospasm in the client with chronic obstructive lung disease. Question 182. The nurse is caring for a client with suspected AIDS dementia complex. The first sign of dementia in the client with AIDS is changes in gait, loss of concentration, problems with speech, seizures. Here are the options. Option A, loss of concentration. The correct answer is option A, loss of concentration. Correct answer, loss of concentration. Question 183. A client being treated with sodium warfarin Coumadin has a prothrombin time of 120 seconds. The nurse recognizes that close assessment for signs of bleeding is needed. The dosage of Coumadin is inadequate to prevent thrombi. The client should limit the intake of foods rich in vitamin K. Skip doses should be made up by taking an additional dose. Here are the options. Option A, close assessment for signs of bleeding is needed. The correct answer is option A, close assessment for signs of bleeding is needed. Correct answer, close assessment for signs of bleeding is needed. Question 184. A client has a tentative diagnosis of myasthenia gravis. The nurse recognizes that myasthenia gravis involves loss of the myelin sheath in portions of the brain and spinal cord and interruption in the transmission of impulses from nerve endings to muscles, progressive weakness and loss of sensation that begins in the lower extremities, loss of coordination, and stiff cogwheel rigidity. Here are the options. Option A, an interruption in the transmission of impulses from nerve endings to muscles. The correct answer is option A, an interruption in the transmission of impulses from nerve endings to muscles. Correct answer, an interruption in the transmission of impulses from nerve endings to muscles. Question 185. The nurse has just admitted a client with emphysema. Arterial blood gas results indicate hypoxia. Which physician prescription would the nurse implement for the best improvement in the client's hypoxia? Elevate the head of the bed 45 degrees. Encourage diaphragmatic breathing. Initiate an elupant nebulizer treatment. Start O2 at 2L/min. Here are the options. Option A, start O2 at 2L/min. The correct answer is option A, start O2 at 2L/min. Correct answer, start O2 at 2L/min. Question 186. Which vitamin should be administered with INH isoniazid in order to prevent possible nervous system side effects? Thiamine, niacin, pyridoxine, riboflavin. Here are the options. Option A. Pyridoxine vitamin B6 is usually administered with INH isoniazid. The correct answer is option A. Pyridoxine vitamin B6 is usually administered with INH isoniazid. Correct answer. Pyridoxine vitamin B6 is usually administered with INH isoniazid. Question 187. A client has suffered a severe electrical burn. Which medication would the nurse expect to have ordered for application to the burned area? Mafenide acetate, sulfamylin, silver nitrate, providoniodine ointment, silver sulfadazine, silvadine. Here are the options. Option A. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. The correct answer is option A. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. Correct answer. Mafenide acetate, sulfamylin, topical agent of choice for electrical burns because of its ability to penetrate thick eschar. Question 188. When administering total parenteral nutrition, the nurse should assess the client for signs of rebound hypoglycemia. The nurse knows that rebound hypoglycemia occurs when the infusion rate is too rapid. The infusion is discontinued without tapering. The solution is infused through a peripheral line. The infusion is administered without a filter. Here are the options. Option A. The infusion is discontinued without tapering. The correct answer is option A. The infusion is discontinued without tapering. Correct answer. The infusion is discontinued without tapering. Question 189. A client's admission history reveals complaints of fatigue, chronic sore throat, and enlarged lymph nodes in the axilla and neck. Which exam would assist the physician to make a tentative diagnosis of leukemia? A complete blood count, an X-ray of the chest, a bone marrow aspiration, a CT scan of the abdomen. Here are the options. Option A. A complete blood count. The correct answer is option A. A complete blood count. Correct answer. A complete blood count. Question 190. During morning assessments, the nurse finds that a client's nephrostomy tube has been clamped. The nurse's first action should be to assess the drainage bag, check for bladder distension, unclamp the tubing, irrigate the tubing. Here are the options. Option A. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. The correct answer is option A. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. Correct answer. Unclamp the tubing. Should not be clamped or irrigated because of the damage that can result to the kidney. Question 191. The physician has ordered a thyroid scan to confirm the diagnosis of a goiter. Before the procedure, the nurse should assess the client for allergies to iodine, bolus the client with Roman 4 fluid, administer an anxiolytic, insert a urinary catheter. Here are the options. Option A. Assess the client for allergies to iodine. The correct answer is option A. Assess the client for allergies to iodine. Correct answer. Assess the client for allergies to iodine. Question 192. The nurse is instructing a patient scheduled for abdominal surgery on the use of a flow-metered incentive spirometer. Which instruction would the nurse include in the teaching plan? Blow on the mouthpiece of the device fast for 3 breaths, followed by slow for 3 more breaths. Use the incentive spirometer once every morning. Inhale slowly on the device to elevate and maintain the flow indicator. Briskly inhale on the device, making sure the flow indicator does not rise. Here are the options. Option A. Inhale slowly on the device to elevate and maintain the flow indicator. The correct answer is option A. Inhale slowly on the device to elevate and maintain the flow indicator. Correct answer. Inhale slowly on the device to elevate and maintain the flow indicator. Question 193. The client with a pacemaker should be taught to report ankle edema, check his blood pressure daily, refrain from using a microwave oven, monitor his pulse rate. Here are the options. Option A. Monitor his pulse rate. The correct answer is option A. Monitor his pulse rate. Correct answer. Monitor his pulse rate. Question 194. The nurse is assessing the client with a total knee replacement 2 hours post-operative. Which information requires notification of the doctor? Scant bleeding on the dressing, low-grade temperature, hemoglobin of 7 gm/dl, urine output of 120 ml during the last hour. Here are the options. Option A. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. The correct answer is option A. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. Correct answer. Hemoglobin of 7 gm/d low and might a blood transfusion might be required. Question 195. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoked during pregnancy? Low birth weight, large for gestational age, preterm birth, but appropriate size for gestation, growth retardation in weight and length. Here are the options. Option A. Low birth weight. The correct answer is option A. Low birth weight. Correct answer. Low birth weight. Question 196. A client has had diarrhea for the past 3 days. Which acid/base imbalance would the nurse expect the client to have? Respiratory alkalosis, metabolic acidosis, metabolic alkalosis, respiratory acidosis. Here are the options. Option A. Metabolic acidosis. The correct answer is option A. Metabolic acidosis. Correct answer. Metabolic acidosis. Question 197. The registered nurse is assigning staff for 4 clients on the 3-11 shift. Which client should be assigned to the LPN? A client with a diagnosis of adult respiratory distress syndrome ARDS who was transferred from the critical care unit at 1400 a 1-hour postoperative colon resection. A client with pneumonia expecting discharge in the morning. A client with cirrhosis of the liver experiencing bleeding from esophageal. Here are the options. Option A. A client with pneumonia expecting discharge in the morning. The correct answer is option A. A client with pneumonia expecting discharge in the morning. Correct answer. A client with pneumonia expecting discharge in the morning. Question 198. A client with hyperthyroidism is taking Ascalith lithium carbonate to inhibit thyroid hormone release. Which complaint by the client should alert the nurse to a problem with the client's medication? The client complains of blurred vision. The client complains of increased thirst and increased urination. The client complains of increased weight gain over the past year. The client complains of rhinorrhea. Here are the options. Option A. The client complains of increased thirst and increased urination. The correct answer is option A. The client complains of increased thirst and increased urination. Correct answer. The client complains of increased thirst and increased urination. Question 199. After several hospitalizations for respiratory ailments, a 6-month-old has been diagnosed as having HIV. The infant's respiratory ailments were most likely due to pneumocystis gyropsysatum calavirus cryptosporidiosis herpes simplex. Here are the options. Option A. Pneumocystis gyropsy. The correct answer is option A. Pneumocystis gyropsy. Correct answer, pneumocystis gyropsy. Question 200. A client has recently been diagnosed with primary open-angle glaucoma. The nurse should tell the client to avoid taking 11 naproxen Benadryl diphenhydramine Tylenol acetaminophen robitussin guaifenesin. Here are the options. Option A. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. The correct answer is option A. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. Correct answer. Benadryl diphenhydramine antihistamines shouldn't be used by client with open-angle glaucoma. They dilate pupil and prevent outflow of aqueous humor. Question 201. The nurse is caring for a client with epilepsy who is being treated with carbamazepine tegretol. Which laboratory value might indicate a serious side effect of this drug? Bumin 10 mg/dl, hemoglobin 13.9g/dl, WBC4, ZBVS/EMM3, platelets 200, DBVS/EMM3. Here are the options. Option A. WBC4, ZBV/EMM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. The correct answer is option A. WBC4, ZBV/EMM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. Correct answer. WBC4, ZBV/EMM3 can cause bone marrow depression and cause problems with the liver. Raise the beam. Question 202. A nurse is caring for a client in the critical care unit who is complaining of chest pain. Nursing assessment reveals a BP of 78/40, shortness of breath, and third-degree AV block on the heart monitor. What is the most appropriate initial action? Provide transcutaneous pacing. Turn the client on his side. Reassess the blood pressure. Consult with cardiology. Here are the options. Option A. Provide transcutaneous pacing. Most appropriate initial action for heart block. The correct answer is option A. Provide transcutaneous pacing. Most appropriate initial action for heart block. Correct answer. Provide transcutaneous pacing. Most appropriate initial action for heart block. Question 203. A client with sickle cell disease is admitted in active labor. Which nursing intervention would be most helpful in preventing a sickling crisis? Obtaining blood pressures every 2 hours, administering pain medication every 3 hours as ordered, monitoring arterial blood gas results, administering Roman 4 fluids at ordered rate of 200 ml/hr. Here are the options. Option A. Administering Roman 4 fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. The correct answer is option A. Administering Roman 4 fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. Correct answer. Administering Roman 4 fluids at ordered rate of 200 ml/hr prevents slowing of blood flow and occlusion. Question 204. The intensive care unit is full and the emergency room just called in a report on a ventilator-dependent client who is being admitted to the medical surgical unit. It would be essential that the nurse have which piece of equipment at the client's bedside? Cardiac monitor, intravenous controller, manual resuscitator, oxygen by nasal cannula. Here are the options. Option A. Manual resuscitator. The correct answer is option A. Manual resuscitator. Correct answer. Manual resuscitator. Question 205. A 2-year-old is hospitalized with suspected intussusception. Which finding is associated with intussusception? Current jelly stools, projectile vomiting, ribbon-like stools, palpable mass over the flank. Here are the options. Option A. Current jelly stools. The correct answer is option A. Current jelly stools. Correct answer. Current jelly stools. Question 206. The nurse is assessing the integumentary system of a dark-skinned individual. Which area would be the most likely to show a skin cancer lesion? Chest, arms, face, palms. Here are the options. Option A. Palms. The correct answer is option A. Palms. Correct answer, palms. Question 207. A client was transferred to the hospital unit as a direct admit. While the nurse is obtaining part of the admission history information, the client suddenly becomes semiconscious. Assessment reveals a systolic BP of 70, heart rate of 130, and respiratory rate of 24. What is the nurse's best initial action? Lower the head of the client's bed. Initiate an Roman 4 with a large bore needle. Notify the physician of the assessment results. Call for the cardiopulmonary resuscitation team. Here are the options. Option A. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. The correct answer is option A. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. Correct answer. Lower the head of the client's bed. Suspect a leaking or ruptured abdominal aortic aneurysm. The first action is to improve blood flow to the brain and elevate the blood pressure. Question 208. The nurse is assessing elderly clients at a community center. Which of the following findings would be the most cause for concern? Dry mouth, loss of 1 inch of height in the last year, stiffened joints, rails bilaterally on chest, auscultation. Here are the options. Option A. Rails bilaterally on chest, auscultation. The correct answer is option A. Rails bilaterally on chest, auscultation. Correct answer. Rails bilaterally on chest, auscultation. Question 209. A client with hepatitis C who has cirrhosis changes has just returned from a liver biopsy. The nurse will place the client in which position? Trendelenburg supine, right side lying, left SIMS. Here are the options. Option A. Right side lying hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. The correct answer is option A. Right side lying hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. Correct answer. Right side lying hemorrhage can occur with liver biopsies. The client is positioned on the right side to keep pressure on the area and prevent bleeding. Question 210. When administering a tuberculin skin test, the nurse should insert the needle at a 15 degrees, angle 30 degrees, angle 45 degrees, angle 90 degrees angle. Here are the options. Option A, 15 degrees angle. The correct answer is option A, 15 degrees angle. Correct answer, 15 degrees angle. Question 211. The nurse is assessing the arterial blood gases ABG of a chest trauma client with the results of pH 7.35, PO 285, PCO 255, and HCO 327. What do these values indicate? Uncompensated respiratory acidosis, uncompensated metabolic acidosis, compensated respiratory acidosis, compensated metabolic acidosis. Here are the options. Option A, compensated respiratory acidosis. The correct answer is option A, compensated respiratory acidosis. Correct answer, compensated respiratory acidosis. Question 212. A client with cancer and metastases to the bone is admitted to the hospital. Which symptom of hypercalcemia causes the nurse the most concern? Weakness, anorexia, flaccid muscles, cardiac changes. Here are the options. Option A, cardiac changes. The correct answer is option A, cardiac changes. Correct answer, cardiac changes. Question 213. The physician has prescribed Cobic cyanocobalamin for a client following a gastric resection. Which lab result indicates that the medication is having its intended effect? Neutrophil count of 4,500 qmm, HGB of 14.2 g/dl, platelet count of 250, 0 qmm, eosinophil count of 200 qmm. Here are the options. Option A, HGB of 14.2 d/dlan, injectable form of cyanocobalamin or vitamin B12. The correct answer is option A, HGB of 14.2 d/dlan, injectable form of cyanocobalamin or vitamin B12. Correct answer, HGB of 14.2 g/dlan, injectable form of cyanocobalamin or vitamin B12. Question 214. A client is admitted with a diagnosis of renal calculi. The nurse should give priority to initiating an intravenous infusion, encouraging oral fluids, administering pain medications, draining the urine. Here are the options. Option A, initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. The correct answer is option A, initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. Correct answer, initiating an intravenous infusion, increasing fluid intake to 3 kml/day will help prevent obstruction by increasing the output. Question 215. The nurse is performing a neurological assessment on a client admitted with TIAs. Assessment findings reveal an absence of the gag reflex. The nurse suspects injury to which of the following cranial nerves? Roman 12 hypoglossal, X vagus, Roman 9 glossopharyngeal, Roman 7 facial. Here are the options. Option A, X vagus. The correct answer is option A, X vagus. Correct answer, X vagus. Question 216. The nurse recognizes which of the following clients as having the highest risk for pulmonary complications after surgery? A 24-year-old with open reduction internal fixation of the ulnar, a 45-year-old with an open cholecystectomy, a 36-year-old after a hysterectomy, a 50-year-old after a lumbar laminectomy. Here are the options. Option A, a 45-year-old with an open cholecystectomy. The correct answer is option A, a 45-year-old with an open cholecystectomy. Correct answer, a 45-year-old with an open cholecystectomy. Question 217. A nurse is observing a local softball game when one of the players is hit in the nose with the ball. The player's nose is visibly deformed and bleeding. The best way for the nurse to control the bleeding is to tilt the head back and pinch the nostrils. Apply a wrapped ice compress to the nose. Pack the nose with soft, clean tissue. Tilt the head forward and pinch the nostrils. Here are the options. Option A, apply a wrapped ice compress to the nose. The correct answer is option A, apply a wrapped ice compress to the nose. Correct answer, apply a wrapped ice compress to the nose. Question 218. The nurse is caring for a client with a diagnosis of hepatitis who is experiencing pruritus. Which would be the most appropriate nursing intervention? Suggest that the client take warm showers. Add baby oil to the client's bath water. Apply powder to the client's skin. Suggest a hot water rinse after bathing. Here are the options. Option A, add baby oil to the client's bath water. The correct answer is option A, add baby oil to the client's bath water. Correct answer, add baby oil to the client's bath water. Question 219. The elderly client is admitted to the emergency room. Which symptom is the client with the fractured hip most likely to exhibit? Pain, disalignment, cool extremity, absence of pedal pulses. Here are the options. Option A, disalignment. The correct answer is option A, disalignment. Correct answer, disalignment. Question 220. The physician has prescribed gantrazine sulfasoxazole 1 gm in divided doses for a client with a urinary tract infection. The nurse should administer the medication with meals or a snack 30 minutes before meals, 30 minutes after meals, 30 minutes after meals. Here are the options. Option A, 30 minutes before meals. The correct answer is option A, 30 minutes before meals. Correct answer, 30 minutes before meals. Question 221. A client is diagnosed with stage Roman 2 Hodgkin's lymphoma. The nurse recognizes that the client has involvement in a single lymph node or single site in more than one node or single organ on the same side of the diaphragm, in lymph nodes on both sides of the diaphragm, in disseminated organs and tissues. Here are the options. Option A, in more than one node or single organ on the same side of the diaphragm. The correct answer is option A, in more than one node or single organ on the same side of the diaphragm. Correct answer, in more than one node or single organ on the same side of the diaphragm. Question 222. A client with cancer received platelet infusions 24 hours ago. Which of the following assessment findings would indicate the most therapeutic effect from the transfusions? Hemoglobin level increase from 8.9 to 10.6 mg/dl, temperature reading of 99.4 degrees F, white blood cell count of 11, 0/mm3, decrease in oozing of blood from Roman 4 site. Here are the options. Option A. Decrease in oozing of blood from Roman 4 site. The correct answer is option A. Decrease in oozing of blood from Roman 4 site. Correct answer. Decrease in oozing of blood from Roman 4 site. Question 223. The nurse is assessing a client following the removal of a pituitary tumor. The nurse notes that the urinary output has increased and that the urine is very dilute. The nurse should give priority to notifying the doctor, immediately documenting the finding in the chart, decreasing the rate of Roman 4 fluids, administering vasopressive medication. Here are the options. Option A. Notifying the doctor immediately, diabetes insipidus. The correct answer is option A. Notifying the doctor immediately, diabetes insipidus. Correct answer. Notifying the doctor immediately, diabetes insipidus. Question 224. A client with human immunodeficiency syndrome has gastrointestinal symptoms, including diarrhea. The nurse should teach the client to avoid calcium-rich foods, canned or frozen vegetables, processed meat, raw fruits and vegetables. Here are the options. Option A. Raw fruits and vegetables. The correct answer is option A. Raw fruits and vegetables. Correct answer. Raw fruits and vegetables. Question 225. A client is admitted with a diagnosis of pernicious anemia. Which of the following signs or symptoms would indicate that the client has been non-compliant with ordered B12 injections? Hyperactivity in the evening hours, weight gain, paresthesia of hands and feet, diarrhea, stools. Here are the options. Option A. Paresthesia of hands and feet, B12 deficit will have symptoms such as paresthesia. The correct answer is option A. Paresthesia of hands and feet, B12 deficit will have symptoms such as paresthesia. Correct answer. Paresthesia of hands and feet, B12 deficit will have symptoms such as paresthesia. Question 226. The Mantoux test is used to determine whether a person has been exposed to tuberculosis. If the test is positive, the nurse will find a fluid-filled vesicle, sharply demarcated erythema, central area of induration, circular blanched area. Here are the options. Option A. Central area of induration, positive Mantoux test is indicated by the presence of induration. The correct answer is option A. Central area of induration, positive Mantoux test is indicated by the presence of induration. Correct answer. Central area of induration, positive Mantoux test is indicated by the presence of induration. Question 227. The nurse is preparing a client for cervical uterine radiation implant insertion. Which will be included in the teaching plan? TV or telephone use will not be allowed while the implant is in place. A Foley catheter is usually inserted. A high-fiber diet is recommended. Excretions will be considered radioactive. Here are the options. Option A. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. The correct answer is option A. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. Correct answer. A Foley catheter is usually inserted. A catheter will allow urine elimination without disrupting the implant. Question 228. A client with multiple sclerosis has an order to receive Solumedrol 200 mg Roman 4 push. The available dose is Solumedrol 250 mg per ml. How much medication will the nurse administer? 0.5 ml, 0.8 ml, 1.1 ml, 1.4 ml. Here are the options. Option A, 0.8 ml. The correct answer is option A, 0.8 ml. Correct answer, 0.8 ml. Question 229. There is an order for a trough level to be drawn on the client receiving vancomycin. The nurse is aware that the lab should collect the blood 15 minutes after the infusion prior to the fourth infusion, 1 hour after the infusion, 2 hours before the second infusion. Here are the options. Option A, prior to the fourth infusion. The correct answer is option A, prior to the fourth infusion. Correct answer, prior to the fourth infusion. Question 230. A client is admitted with a diagnosis of polycythemia vera. The nurse should closely monitor the client for increased blood pressure, decreased respirations, increased urinary output, decreased oxygen saturation. Here are the options. Option A, increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. The correct answer is option A, increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. Correct answer, increased blood pressure, abnormal increase in the number of circulating red blood cells that results in increased viscosity. Question 231. Intraarterial chemotherapy primarily benefits the client by applying greater concentrations of medication directly to the malignant tumor. An additional benefit of intraarterial chemotherapy is prevention of nausea and vomiting, treatment of micrometastases, eradication of bone pain, prevention of therapy-induced anemia. Here are the options. Option A, treatment of micrometastases. The correct answer is option A, treatment of micrometastases. Correct answer, treatment of micrometastases. Question 232. A client has ataxia following a cerebral vascular accident. The nurse should supervise the client's ambulation, measure the client's intake and output, request a consult for speech therapy, provide the client with a magic slate. Here are the options. Option A, supervise the client's ambulation. Affects the client's mobility, making falls more likely. The correct answer is option A, supervise the client's ambulation. Affects the client's mobility, making falls more likely. Correct answer, supervise the client's ambulation. Affects the client's mobility, making falls more likely. Question 233. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid using which condiment? Mustard, salt, pepper, ketchup. Here are the options. Option A, pepper is unprocessed and may contain bacteria. The correct answer is option A. Pepper is unprocessed and may contain bacteria. Correct answer. Pepper is unprocessed and may contain bacteria. Question 234. The nurse caring for a client with a suspected peptic ulcer recognizes which exam as the one most reliable in diagnosing the disease? Upper gastrointestinal X-ray, gastric analysis, endoscopy procedure, barium studies, X-ray. Here are the options. Option A. Endoscopy procedure. The correct answer is option A. Endoscopy procedure. Correct answer, endoscopy procedure. Question 235. The physician has ordered a low-residue diet for a client with Crohn's disease. Which food is not permitted in a low-residue diet? Mashed potatoes, smooth peanut butter, fried fish, rice. Here are the options. Option A. Fried fish. Fried foods are not permitted on a low-residue diet. The correct answer is option A. Fried fish. Fried foods are not permitted on a low-residue diet. Correct answer. Fried fish. Fried foods are not permitted on a low-residue diet. Question 236. The physician has prescribed cyclogel cyclopentylate hydrochloride drops for a client following a sclerobuckling. The nurse knows that the purpose of the medication is to rest the muscles of accommodation, prevent postoperative infection, constrict the pupils, reduce the production of aqueous humor. Here are the options. Option A. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. The correct answer is option A. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. Correct answer. Rest the muscles of accommodation. It's a cycloplegic medication that inhibits constriction of the pupil. Question 237. A client with B-negative blood requires a blood transfusion during surgery. If no B-negative blood is available, the client should be transfused with A positive blood, B positive blood, O negative blood, AB negative blood. Here are the options. Option A. O negative blood. The correct answer is option A. O negative blood. Correct answer. O negative blood. Question 238. The nurse is admitting a client with a suspected duodenal ulcer. The client will most likely report that his abdominal discomfort decreases when he avoids eating, rests in a recumbent position, eats a meal or snack, sits upright after eating. Here are the options. Option A. Eats a meal or snack. The correct answer is option A. Eats a meal or snack. Correct answer. Eats a meal or snack. Question 239. A client with a history of diverticulitis complains of abdominal pain, fever, and diarrhea. Which food is most likely responsible for the client's symptoms? Mashed potatoes, steamed carrots, baked fish, whole grain cereal. Here are the options. Option A. Whole grain cereal. The correct answer is option A. Whole grain cereal. Correct answer. Whole grain cereal. Question 240. A client with an esophageal tamponade develops symptoms of respiratory distress, including inspiratory stridor. The nurse should give priority to applying oxygen at 4 L via nasal cannula, removing the tube after deflating the balloons, elevating the head of the bed to 45 degrees, increasing the pressure in the esophageal balloon. Here are the options. Option A. Removing the tube after deflating the balloons. The correct answer is option A. Removing the tube after deflating the balloons. Correct answer. Removing the tube after deflating the balloons. Question 241. The client is instructed regarding foods that are low in fat and cholesterol. Which diet selection is lowest in saturated fats? Macaroni and cheese shrimp with rice, turkey breast spaghetti with meat sauce. Here are the options. Option A, turkey breast. The correct answer is option A, turkey breast. Correct answer, turkey breast. Question 242. Which of the following findings would be expected in the infant with biliary atresia? Rapid weight gain and hepatomegaly, dark stools and poor weight gain, abdominal distension and poor weight gain, abdominal distension and rapid weight gain. Here are the options. Option A, abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. The correct answer is option A, abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. Correct answer, abdominal distension and poor weight gain, abdominal distension, poor weight gain, and clay-colored stools. Question 243. The nurse caring for a client with a closed head injury obtains an intracranial pressure ICP reading of 17 mmHg. The nurse recognizes that the ICP is elevated and the doctor should be notified. The ICP is normal, therefore, no further action is needed. The ICP is low and the client needs additional Roman IV fluids. The ICP reading is not as reliable as the Glasgow Coma scale. Here are the options. Option A, the ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. The correct answer is option A. The ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. Correct answer. The ICP is elevated and the doctor should be notified. The ICP normally ranges from 4 mmHg to 10 mmHg, with upper limits of 15 mmHg. Question 244. The nurse in the emergency room is caring for a client with multiple rib fractures and a pulmonary contusion. Assessment reveals a respiratory rate of 38, a heart rate of 136, and restlessness. Which associated assessment finding would require immediate intervention? Occasional small amounts of hemoptysis midline trachea with wheezing on auscultation, subcutaneous air, and absent breath sounds, pain when breathing deeply, with rales in the upper lobes. Here are the options. Option A, subcutaneous air and absent breath sounds with / increased heart rate, dyspnea, and restlessness indicate a pneumothorax. The correct answer is option A. Subcutaneous air and absent breath sounds with / increased heart rate, dyspnea, and restlessness indicate a pneumothorax. Correct answer, subcutaneous air and absent breath sounds with / increased heart rate, dyspnea, and restlessness indicate a pneumothorax. Question 245. The nurse is caring for a client who is recovering from a fractured femur. Which diet selection would be best for this client? Loaded baked potato, fried chicken, and tea-dressed cheeseburger, French fries, and a Diet Coke tuna fish salad on sourdough bread, potato chips, and skim milk mandarin orange salad, broiled chicken, and milk. Here are the options. Option A, mandarin orange salad, broiled chicken, and milk. The correct answer is option A, mandarin orange salad, broiled chicken, and milk. Correct answer: mandarin orange salad, broiled chicken, and milk. Question 246. A client with AIDS complains of a weight loss of 20 pounds in the past month. Which diet is suggested for the client with AIDS? High calorie, high protein, high fat, high calorie, high carbohydrate, low protein, high calorie, low carbohydrate, high fat, high calorie, high protein, low fat. Here are the options. Option A: high calorie, high protein, low fat. The correct answer is option A: high calorie, high protein, low fat. Correct answer: high calorie, high protein, low fat. Question 247. The nurse is reviewing the lab reports of a client who is HIV positive. Which lab report provides information regarding the effectiveness of the client's medication regimen? ELISA Western blot viral load CD4 count. Here are the options. Option A: viral load. The correct answer is option A: viral load. Correct answer: viral load. Question 248. A client taking Dilantin and phenytoin for tonic-clonic seizures is preparing for discharge. Which information should be included in the client's discharge care plan? The medication can cause dental staining. The client will need to avoid a high carbohydrate diet. The client will need a regularly scheduled blood work. The medication can cause problems with drowsiness. Here are the options. Option A: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. The correct answer is option A: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. Correct answer: the client will need a regularly scheduled blood work. Adverse effects of Dilantin include agranulocytosis and aplastic anemia. Question 249. A client with non-tropical sprue has an exacerbation of symptoms. Which meal selection is responsible for the recurrence of the client's symptoms? Toss salad with oil and vinegar dressing, baked potato with sour cream and chives, cream of tomato soup and crackers, mixed fruit, and yogurt. Here are the options. Option A: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. The correct answer is option A: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. Correct answer: cream of tomato soup and crackers like celiac caused by the ingestion of gluten found in wheat, oats, barley, and rye. Question 250. The physician has ordered injections of Numega Oprovecin for a client receiving chemotherapy for prostate cancer. Which findings suggest that the medication is having its desired effect? HT 12.8G platelets 250 ZVBN through neutrophils 4 ZVBN through RBC 4.7 milli. Here are the options. Option A: platelets 250 0 3 stimulates the production of platelets. The correct answer is option A: platelets 250 0 3 stimulates the production of platelets. Correct answer: platelets 250 0 3 stimulates the production of platelets. Question 251. The mother of a child with cystic fibrosis tells the nurse that her child makes snoring sounds when breathing. The nurse is aware that many children with cystic fibrosis have choanal atresia, nasal polyps, septal deviations, enlarged adenoids. Here are the options. Option A. Nasal polyps. The correct answer is option A. Nasal polyps. Correct answer, nasal polyps. Question 252. A client has signs of increased intracranial pressure. Which one of the following is an early indicator of deterioration in the client's condition? Widening pulse pressure, decrease in the pulse rate, dilated, fixed pupils, decrease in level of consciousness. Here are the options. Option A. Decrease in level of consciousness. The correct answer is option A. Decrease in level of consciousness. Correct answer, decrease in level of consciousness. Question 253. A client's chest tube drainage device has continuous bubbling in the water seal chamber. What is the nurse checking for when she clamps different areas of the tube to find out where the bubbling stops? An air leak in the system, the suction being too high, the suction being too low, attention pneumothorax. Here are the options. Option A. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. The correct answer is option A. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. Correct answer. An air leak in the system, clamping various areas of the tube allows the nurse to assess for a leak in the tubing. When the bubbling stops. Question 254. The physician has ordered an infusion of osmotrol mannitol for client with increased intracranial pressure. Which finding indicates the direct effectiveness of the drug? Increased pulse rate, increased urinary output, decreased diastolic blood pressure, increased pupil size. Here are the options. Option A. Increased urinary output, osmotic diuresis inhibits reabsorption of sodium and water. The correct answer is option A. Increased urinary output, osmotic diuresis inhibits reabsorption of sodium and water. Correct answer. Increased urinary output, osmotic diuresis inhibits reabsorption of sodium and water. Question 255. A client with osteoarthritis has a prescription for Celebrex celecoxib. Which instruction should be included in the discharge teaching? Take the medication with milk. Report chest pain to the physician. Remain upright 30 minutes after taking the medication. Allow 6 weeks for optimal effects. Here are the options. Option A. Report chest pain to the physician. Cox Roman II inhibitor associated with heart attacks and strokes. The correct answer is option A. Report chest pain to the physician. Cox Roman II inhibitor associated with heart attacks and strokes. Correct answer. Report chest pain to the physician. Cox Roman II inhibitor associated with heart attacks and strokes. Question 256. The nurse is formulating a plan of care for a client with a goiter. The priority nursing diagnosis for the client with a goiter is body image disturbance related to enlargement of the neck, activity intolerance related to fatigue, nutrition imbalance, less than body requirements, related to increased metabolism, risk for ineffective airway clearance related to pressure of goiter on the trachea. Here are the options. Option A. Risk for ineffective airway clearance related to pressure of goiter on the trachea. The correct answer is option A. Risk for ineffective airway clearance related to pressure of goiter on the trachea. Correct answer. Risk for ineffective airway clearance related to pressure of goiter on the trachea. Question 257. The nurse is evaluating cerebral perfusion outcomes for a client with a subdural hematoma. The nurse evaluates which of the following as a favorable outcome for this client. Arterial blood gas PO2 of 98, increase in lethargy, pupils slow to react to light, temperature of 101 degrees F. Here are the options. Option A. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. The correct answer is option A. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. Correct answer. Arterial blood gas PO2 of 98 indicates adequate oxygenation and a favorable outcome. Question 258. The nurse is providing dietary instructions for a client with iron deficiency anemia. Which food is a poor source of iron? Tomatoes, legumes, dried fruits, nuts. Here are the options. Option A. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. The correct answer is option A. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. Correct answer. Tomatoes, poor source of iron, although they are an excellent source of vitamin C, which increases iron absorption. Question 259. The nurse is making assignments for the day. The staff consists of an RN, a novice RN, an LPN, and a nursing assistant. Which client should be assigned to the RN? A client with peptic ulcer disease, a client with skeletal traction for a fractured femur, a client with an abdominal cholecystectomy, a client with an esophageal tamponade. Here are the options. Option A. A client with an esophageal tamponade to control bleeding in the client with esophageal varices. The correct answer is option A. A client with an esophageal tamponade to control bleeding in the client with esophageal varices. Correct answer. A client with an esophageal tamponade to control bleeding in the client with esophageal varices. Question 260. A client with a head injury develops syndrome of inappropriate antidiuretic hormone SIAD. Which physician prescription would the nurse question? D5W at 200 ml/HR democlocycline diclomycin 150 mg Q6H daily weights, monitor intake and output. Here are the options. Option A. D5W at 200 ml/HR fluid restriction is part of the treatment plan. Gives the client too much fluid volume. The correct answer is option A. D5W at 200 ml/HR fluid restriction is part of the treatment plan. Gives the client too much fluid volume. Correct answer. D5W at 200 ml/HR fluid restriction is part of the treatment plan. Gives the client too much fluid volume. Question 261. The nurse is caring for a client after a motor vehicle accident. The client has a fractured tibia, and bone is noted protruding through the skin. Which action is of priority? Provide manual traction above and below the leg. Cover the bone area with a sterile dressing. Apply an ACE bandage around the entire lower limb. Place the client in the prone position. Here are the options. Option A. Cover the bone area with a sterile dressing. The correct answer is option A. Cover the bone area with a sterile dressing. Correct answer. Cover the bone area with a sterile dressing. Question 262. A client is discharged home with a prescription for Coumadin sodium warfarin. The client should be instructed to avoid antihistamines containing diphenhydramine, increase the intake of all vegetables, have a PTT checked monthly, have a CBC drawn every 6 months. Here are the options. Option avoid antihistamines containing diphenhydramine can increase the bleeding time. The correct answer is option A. Avoid antihistamines containing diphenhydramine can increase the bleeding time. Correct answer. Avoid antihistamines containing diphenhydramine can increase the bleeding time. Question 263. The nurse is performing discharge teaching for a client after cardiac catheterization. Which statement by the client indicates a need for further teaching? I should not bend, strain, or lift heavy objects for 1 day. If bleeding occurs, I should place an ice bag on the site for 10 minutes. I need to call the doctor if my temperature goes above 101 degrees F. I should talk to the doctor to find out when I can go back to work. Here are the options. Option A. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. The correct answer is option A. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. Correct answer. If bleeding occurs, I should place an ice bag on the site for 10 minutes. Any bleeding, new bruising, or pain at the puncture site, the physician should be notified. Question 264. The nurse is preparing to discharge a client following a laparoscopic cholecystectomy. The nurse should tell the client to avoid a tub bath for 48 hours. Tell the client to expect clay-colored stools. Tell the client that she can expect lower abdominal pain for the next week. Tell the client to report pain in the back or shoulders. Here are the options. Option A. Tell the client to avoid a tub bath for 48 hours. The correct answer is option A. Tell the client to avoid a tub bath for 48 hours. Correct answer. Tell the client to avoid a tub bath for 48 hours. Question 265. Which finding is the best indication that a client with ineffective airway clearance needs suctioning? Oxygen saturation, respiratory rate, breath sounds, arterial blood gases. Here are the options. Option A. Breath sounds. The correct answer is option A. Breath sounds. Correct answer, breath sounds. Question 266. A client taking antiretroviral drugs reports his last blood work showed a drop of 3 units in the viral load. The nurse understands that the virus is no longer detectable. 90% of the viral load has been eliminated. 95% of the viral load has been eliminated. 99% of the viral load has been eliminated. Here are the options. Option A. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. The correct answer is option A. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. Correct answer. 99% of the viral load has been eliminated. A drop of 3 units indicates that the viral load has decreased by 99%. Question 267. Which of the following nursing interventions has the highest priority for the client scheduled for an intravenous pyelogram? Providing the client with a favorite meal for dinner, asking if the client has allergies to shellfish, encouraging fluids the evening before the test, telling the client what to expect during the test. Here are the options. Option A. Asking if the client has allergies to shellfish. The correct answer is option A. Asking if the client has allergies to shellfish. Correct answer. Asking if the client has allergies to shellfish. Question 268. The client presents to the clinic with a serum cholesterol of 275 mg/dl and is placed on rosuvastatin Crestor. Which instruction should be given to the client taking rosuvastatin Crestor? Report unexplained muscle weakness to the physician. Allow 6 months for the drug to take effect. Take the medication with fruit juice. Report difficulty sleeping. Here are the options. Option A. Report unexplained muscle weakness to the physician. Antilipidemic. The correct answer is option A. Report unexplained muscle weakness to the physician. Antilipidemic. Correct answer. Report unexplained muscle weakness to the physician. Antilipidemic. Question 269. A client hospitalized for treatment of congestive heart failure is to be discharged with a prescription for Digitec Digixin 0.25 mg daily. Which of the following statements indicates that the client needs further teaching? I will need to take the medication at the same time each day. I can prevent stomach upset by taking the medication with an antacid. I can help prevent drug toxicity by eating foods containing fiber. I will need to report visual changes to my doctor. Here are the options. Option A. I can prevent stomach upset by taking the medication with an antacid. The correct answer is option A. I can prevent stomach upset by taking the medication with an antacid. Correct answer. I can prevent stomach upset by taking the medication with an antacid. Question 270. The physician has ordered an MRI as a part of the client's diagnostic workup. An MRI should not be done if the client has the need for oxygen therapy, a history of claustrophobia, a permanent pacemaker, sensory deafness. Here are the options. Option A. A permanent pacemaker. The correct answer is option A. A permanent pacemaker. Correct answer. A permanent pacemaker. Question 271. The nurse is caring for a client with rheumatoid arthritis. The nurse knows that the client's early morning symptoms will be most improved by taking a warm shower upon awakening, applying ice packs to the joints, taking 2 aspirin before going to bed, going for an early morning walk. Here are the options. Option A. Taking a warm shower upon awakening. The correct answer is option A. Taking a warm shower upon awakening. Correct answer. Taking a warm shower upon awakening. Question 272. The nurse is performing a physical assessment on a newly admitted client. The last step in the physical assessment is inspection, auscultation, percussion, palpation. Here are the options. Option A. Palpation. The correct answer is option A. Palpation. Correct answer. Palpation. Question 273. The physician orders the removal of an indwelling catheter the second post-operative day for a client with a prostatectomy. The client complains of pain and dribbling of urine the first time he voids. The nurse should tell the client that using warm compresses over the bladder will lessen the discomfort. Perineal exercises will be started in a few days to help relieve his symptoms. If the symptoms don't improve, the catheter will have to be reinserted. His complaints are common and will improve over the next few days. Here are the options. Option A. His complaints are common and will improve over the next few days. The correct answer is option A. His complaints are common and will improve over the next few days. Correct answer. His complaints are common and will improve over the next few days. Question 274. The glycosylated hemoglobin of a 40-year-old client with diabetes mellitus is 2.5%. The nurse understands that the client can have a higher calorie diet. The client has good control of her diabetes. The client requires adjustment in her insulin dose. The client has poor control of her diabetes. Here are the options. Option A. The client has good control of her diabetes. The correct answer is option A. The client has good control of her diabetes. Correct answer. The client has good control of her diabetes. Question 275. A student nurse is observing a neurological nurse perform an assessment. When the nurse asks the client to stick out his tongue, the nurse is assessing the function of which cranial nerve? Roman 2 optic olfactory X vagus Roman 12 hypoglossal. Here are the options. Option A. Roman 12 hypoglossal. The correct answer is option A. Roman 12 hypoglossal. Correct answer. Roman 12 hypoglossal. Question 276. The nurse is reviewing the lab results of a client's arterial blood gases. The PA CO2 indicates effective functioning of the kidneys, pancreas, lungs, liver. Here are the options. Option A. Lungs. The correct answer is option A. Lungs. Correct answer. Lungs. Question 277. A client with a C3 spinal cord injury experiences autonomic hyperreflexia. After placing the client in high Fowler's position, the nurse's next action should be to notify the physician, make sure the catheter is patent, administer an antihypertensive, provide supplemental oxygen. Here are the options. Option A. Make sure the catheter is patent, raising the client's head to lower the blood pressure. The correct answer is option A. Make sure the catheter is patent, raising the client's head to lower the blood pressure. Correct answer. Make sure the catheter is patent, raising the client's head to lower the blood pressure. Question 278. 4 clients are admitted to a medical unit. If only one private room is available, it should be assigned to the client with ulcerative colitis, the client with neutropenia, the client with cholecystitis, the client with polycythemia vera. Here are the options. Option A. The client with neutropenia. The correct answer is option A. The client with neutropenia. Correct answer. The client with neutropenia. Question 279. Which diet is associated with an increased risk of colorectal cancer? Low protein, complex carbohydrates, high protein, simple carbohydrates, high fat, refined carbohydrates, low carbohydrates, complex proteins. Here are the options. Option A. High fat, refined carbohydrates. The correct answer is option A. High fat, refined carbohydrates. Correct answer. High fat, refined carbohydrates. Question 280. Hyperstat diazoxide is ordered for a patient with hypertension. Which side effect is associated with the medication? Photophobia, numbness of the hands, urinary frequency, alopecia. Here are the options. Option A. Numbness of the hands. The correct answer is option A. Numbness of the hands. Correct answer, numbness of the hands. Question 281. The nurse is reviewing the lab reports on several clients. Which one should be reported to the physician immediately? A serum creatinine of 5.2 mg/dl in a client with chronic renal failure, a positive C-reactive protein in a client with rheumatic fever, a hematocrit of 52% in a client with gastroenteritis, a white cell count of 200 Cu/mm in a client taking dilantin phenytoin. Here are the options. Option A. A white cell count of 200 Cu/mm in a client taking dilantin phenytoin. The correct answer is option A. A white cell count of 200 Cu/mm in a client taking dilantin phenytoin. Correct answer. A white cell count of 200 Cu/mm in a client taking dilantin phenytoin. Question 282. The nurse has performed nutritional teaching on a client with gout who is placed on a low-purine diet. Which selection by the client would indicate that teaching has been ineffective? Boiled cabbage, apple, peach, cobbler, spinach. Here are the options. Option A. Spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. The correct answer is option A. Spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. Correct answer. Spinach. Spinach should be avoided on a low-purine diet. Other foods to avoid include poultry, liver, lobster, oysters, peas, fish, and oatmeal. Question 283. The nurse is caring for a client in the acute care unit. Initial laboratory values reveal serum sodium of 156 mg/L. What behavior changes would the nurse expect the client to exhibit? Hyporeflexia, manic behavior, depression, muscle cramps. Here are the options. Option A. Manic behavior. The correct answer is option A. Manic behavior. Correct answer, manic behavior. Question 284. The physician has diagnosed a client with cirrhosis characterized by asterixis. If the nurse assesses the client with asterixis, he can expect to find irregular movement of the wrist, enlargement of the breasts, dilated veins around the umbilicus, redness of the palmar surfaces. Here are the options. Option A. Irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. The correct answer is option A. Irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. Correct answer. Irregular movement of the wrist, flapping, tremors, irregular flexion and extension of wrists when arms are extended and wrist is hyperextended with the fingers separated. Question 285. The client with color blindness will have problems distinguishing which of the following colors? Orange, violet, red, yellow. Here are the options. Option A. Violet, violets, blues, and green. The correct answer is option A. Violet, violets, blues, and green. Correct answer. Violet, violets, blues, and green. Question 286. The nurse is caring for a client post-op femoral popliteal bypass graft. Which post-operative assessment finding would require immediate physician notification? edema of the extremity and pain at the incision site, a temperature of 99.6 degrees F, and redness of the incision serous drainage noted at the surgical area, a loss of posterior tibial and dorsalis pedis pulses. Here are the options. Option A. A loss of posterior tibial and dorsalis pedis pulses. The correct answer is option A. A loss of posterior tibial and dorsalis pedis pulses. Correct answer. A loss of posterior tibial and dorsalis pedis pulses. Question 287. The nurse is caring for a client with osteoporosis who is being discharged on alendronate Fosamax. Which statement would indicate a need for further teaching? I should take the medication immediately before bedtime every night. I should remain in an upright position for 30 minutes after taking Fosamax. The medication should be taken by mouth with water. I should not have any food with this medication. Here are the options. Option A. I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. The correct answer is option A. I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. Correct answer. I should take the medication immediately before bedtime every night. Should be taken in the morning before food or other medications are ingested, with water as the only liquid. Question 288. The nurse is caring for an older client hospitalized with dehydration. Which site should be used to check for skin turgor? Hand, arm, abdomen, forehead. Here are the options. Option A. Forehead, forehead, or chest. The correct answer is option A. Forehead, forehead, or chest. Correct answer. Forehead, forehead, or chest. Question 289. In order to reduce the risk of hypotension and red man syndrome, infusions of vancomycin and vancomycin should be administered within 15 minutes after giving Benadryl diphenhydramine over 1 hour with Zantac ranitidine or other histamine. Here are the options. Option over 1 hour. The correct answer is option A. Over 1 hour. Correct answer. Over 1 hour. Question 290. The nurse is caring for a client with epilepsy who is to receive phenytoin sodium dilantin 100 mg Roman 4 push. The client has a Roman 4 of D51-2 and S infusing at 100 ml/HR. When administering the dilantin, which is the appropriate initial nursing action, obtain an ambu bag and put it at bedside. Insert a 16G Roman 4 catheter. Flush the Roman 4 line with normal saline. Remedicate with promethazine phenergan Roman 4 push. Here are the options. Option A. Flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. The correct answer is option A. Flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. Correct answer. Flush the Roman 4 line with normal saline. Because dilantin crystallizes in the tubing if D5W is present. Question 291. A client is admitted with a 2-day history of nausea and vomiting. Which Roman 4 fluid is appropriate for the client with moderate dehydration? Lactated Ringer's dextrose 1% and water 3%, normal saline dextrose 5%/5% normal saline. Here are the options. Option A. Lactated Ringer's. The correct answer is option A. Lactated ringers. Correct answer, lactated ringers. Question 292. A client with prostate cancer is being treated with iridium seed implants. The nurse's discharge teaching should include telling the client to strain his urine, increase his fluid intake, report urinary frequency, avoid prolonged sitting. Here are the options. Option A. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. The correct answer is option A. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. Correct answer. Strain his urine. Iridium seeds can be expelled during urination. Client should be taught to strain his urine and report to PCP. Seeds are expelled. Question 293. A client weighing 150 pounds has received burns over 50% of his body at 1,200 hours. Using the Parkland formula, calculate the expected amount of fluid that the client should receive by 2,000 hours. 3, 4,006, 80,010, 20,013, 600. Here are the options. Option A. 6,800. The correct answer is option A. 6,800. Correct answer, 6,800. Question 294. The nurse is developing a plan of care for a client with a newly created ileostomy. The priority nursing diagnosis for this client is risk for deficient fluid volume related to excessive fluid loss from ostomy, disturbed body image related to presence of ostomy, risk for impaired skin integrity related to irritation from ostomy appliance, deficient knowledge of ostomy care related to unfamiliarity with information resources. Here are the options. Option A. Risk for deficient fluid volume related to excessive fluid loss from ostomy. The correct answer is option A. Risk for deficient fluid volume related to excessive fluid loss from ostomy. Correct answer. Risk for deficient fluid volume related to excessive fluid loss from ostomy. Question 295. Which person is at greatest risk for developing Lyme's disease? Computer programmer, elementary teacher, veterinarian, landscaper. Here are the options. Option A. Landscaper. The correct answer is option A. Landscaper. Correct answer, landscaper. Question 296. A client with increased intracranial pressure is placed on mechanical ventilation with hyperventilation. The nurse knows that the purpose of the hyperventilation is to prevent the development of acute respiratory failure, decrease cerebral blood flow, increase systemic tissue perfusion, prevent cerebral anoxia. Here are the options. Option A. Decrease cerebral blood flow. The correct answer is option A. Decrease cerebral blood flow. Correct answer. Decrease cerebral blood flow. Question 297. The first action that the nurse should take if she finds the client has an O2 saturation of 68% is elevate the head of the bed, recheck the O2 saturation in 30 minutes, apply oxygen by mask, assess the heart rate. Here are the options. Option A. Apply oxygen by mask. The correct answer is option A. Apply oxygen by mask. Correct answer. Apply oxygen by mask. Question 298. The nurse has given instructions on pursed lip breathing to a client with COPD. Which statement by the client would indicate effective teaching? I should inhale through my mouth very deeply. I should tighten my abdominal muscles with inhalation. I should contract my abdominal muscles with exhalation. I should make inhalation twice as long as exhalation. Here are the options. Option A. I should contract my abdominal muscles with exhalation. The correct answer is option A. I should contract my abdominal muscles with exhalation. Correct answer. I should contract my abdominal muscles with exhalation. Question 299. Which action by the healthcare worker indicates a need for further teaching? The nursing assistant ambulates the elderly client using a gait belt. The nurse wears goggles while performing a venipuncture. The nurse washes his hands after changing a dressing. The nurse wears gloves to monitor the Roman IV infusion rate. Here are the options. Option A. The nurse wears gloves to monitor the Roman IV infusion rate. The correct answer is option A. The nurse wears gloves to monitor the Roman IV infusion rate. Correct answer. The nurse wears gloves to monitor the Roman IV infusion rate. Question 300. A patient with pulmonary tuberculosis is receiving combination therapy. To increase the effects of the medication, the patient may be given indaropropranolol, dilantin, phenytoin, benimidprobamycid, neoral cyclosporine. Here are the options. Option A. Benimidprobamycid. The correct answer is option A. Benimidprobamycid. Correct answer. Benimidprobamycid. Question 301. Which aminophylline level is associated with signs of toxicity? 5 micrograms/ml, 10 micrograms/ml, 20 micrograms/ml, 25 micrograms/ml. Here are the options. Option A. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. The correct answer is option A. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. Correct answer. 25 micrograms/ml. Therapeutic range for aminophylline is 10-20 micrograms/ml. Question 302. The nurse is completing an assessment history of a client with pernicious anemia. Which complaint differentiates pernicious anemia from other types of anemia? Difficulty in breathing after exertion, numbness and tingling in the extremities, a faster than usual heart rate, feelings of lightheadedness. Here are the options. Option A. Numbness and tingling in the extremities of men with pernicious anemia, but not those with other types of anemia. The correct answer is option A. Numbness and tingling in the extremities of men with pernicious anemia, but not those with other types of anemia. Correct answer. Numbness and tingling in the extremities of men with pernicious anemia, but not those with other types of anemia. Question 303. When caring for a client with an anterior cervical discectomy, the nurse should give priority to assessing for postoperative bleeding. The nurse should pay particular attention to drainage on the surgical dressing, complaints of neck pain, bleeding from the mouth, swelling in the posterior neck. Here are the options. Option A. Bleeding from the mouth. The correct answer is option A. Bleeding from the mouth. Correct answer. Bleeding from the mouth. Question 304. The nurse is preparing to administer oral potassium chloride to an elderly client. Which action should the nurse take before administering the medication? Perform a fingerstick for morning glucose assess for signs of hypocalcemia. Withhold food for 30 minutes. Check the creatinine level. Here are the options. Option A. Check the creatinine level. Determine renal function. The correct answer is option A. Check the creatinine level. Determine renal function. Correct answer. Check the creatinine level. Determine renal function. Question 305. A client with tuberculosis has a prescription for myambutal ethambutol HCl. The nurse should tell the client to notify the doctor immediately if he notices gastric distress, changes in hearing, red discoloration of body fluids, changes in color vision. Here are the options. Option A. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. The correct answer is option A. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. Correct answer. Changes in color vision. Adverse reaction to myambutal is changes in visual acuity or color vision. Question 306. A client with inflammatory bowel disease IBD requires an ileostomy. The nurse would instruct the client to do which of the following measures as an essential part of caring for the stoma? Perform massage of the stoma 3 times a day. Include high-fiber foods in the diet, especially nuts. Limit fluid intake to prevent loose stools. Cleanse the peristomal skin meticulously. Here are the options. Option A. Cleanse the peristomal skin meticulously. The correct answer is option A. Cleanse the peristomal skin meticulously. Correct answer. Cleanse the peristomal skin meticulously.